This conference will now be recorded.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right. Public comments. No members of the public here. No bubbles.
Nope.
So, we're going to move on to our administrative business.
Okay. In your packet, you just had a notification, which is a public notice relating to an agricultural operation. You have financial reports. I'll just take up part of this space in the packet there.
Yeah.
I wanted to talk to you briefly. I mean, I included the information in your packet about the KAC conference. It will be just online, and it gives you kind of the outline. It's just a business meeting this year, and it's all online. There's no charge, but you do need to register if you want to attend that. And that date is, well, the legislative policy review is on the 13th of October, and then the one-day virtual meeting is on the October 14th.
October 14th.
Yeah. So let me know if you are interested in registering for that. Okay. We do.
We have to have a voting member for that.
Well, if you want to vote, then yes, and I have a little bit later in administrative, I do have the appointment forms for you all to make a decision as far as a voting delegate for the KAC meeting and also the K-Camp annual meeting. So obviously if you're someone would need to attend if you're planning to vote. Otherwise, if you're not planning to vote. Okay. So I'll kind of need you to be thinking about that and have a decision kind of by the time we talk about appointing those designees for voting. I did want to let you know, I heard from Bruce Schultz from Blue Cross Blue Shield, and he's actually going to be retiring in October, but he said that Blue Cross Blue Shield has made a decision to refund all of the dental premiums for the month of April 2000 because nobody could go to the dentist. So they are going to be refunding us, and that will be about $6,700. A portion of that belongs to the member, so we'll have to refund that out to those employees that paid for coverage there, but the county will get our portion back. So anyway, I just thought I'd let you know that.
How about a preview for any preview of where our premiums are headed?
No, he didn't give me any.
Okay.
That was just a voicemail.
Okay.
But I thought I'd pass that along.
You might let him know, whoever is taking over his area. It'd be nice if, they just drop by sometime, introduce themselves, so we know who that contact person is. Maybe he doesn't know yet.
Yeah, I don't know that he does. But. Okay.
Yeah.
What's that?
Nothing.
Oh.
Scratch that.
Okay. We do have some change orders. Let's see, or something else. These are actually all supplements, so no signatures required today.
That was on. Did we give an address? Property address 234 West 5th. Oh, that's the church sold that, okay. Yeah, okay, I know where it's at. Church sold their,
House next to the church.
no, it's not next to the church, but it's a block or two down. Doubled up, what's the?
Okay, I do have the minutes of September 8th.
Everybody had a chance to read the minutes. Any questions, corrections? I'll make a motion to approve the minutes of September 8th.
Second.
Second by Randy. Any other discussion? All those in favor? Aye. Is on?
Yeah.
Oh, okay.
We do have just one form for one of the businesses that you approved for the CDBG grants. That just needs the chairman's signature. same form that we've used for each business, so.
Anybody like to make a motion to authorize signature?
I'll make a motion to authorize the chairman to sign on the CCD.
Second.
Motion by Kent, second by Randy. Any other discussion?
What for business is it?
Affordable street rods.
Is that in Peabody? Okay.
All those in favor?
Aye.
Aye. 5-0.
Okay.
Are we still working on the second round for?
Third round, actually.
We're on a third round through, applications due November 13th. So,
And that's about as far as you can go.
yeah.
If it doesn't fill
I mean,
out.
it would really encourage the commissioners to get out and spread the word in your areas. I put it on social media, I sent a press release to the newspapers, that, you know, this money is still available, so.
How much is left, we've approved 30, no, not quite 30, this one was at 3,000. I mean, how many dollars are left out of the 170?
I can figure that up for you and get back to you.
It's fairly substantial.
Yeah, the majority of it is
I
left, I would
think
say.
after the first round, there was 117,000 left.
No, that's how much we started with.
Oh, sorry.
Yeah.
I've
So-
got two applications out in Peabody, but, one of them was just last week, the other one was the week before that, so I don't know where they've got theirs back in yet.
Did the food bank get money from us?
Yeah, that was right off the top.
Well, we have the grant. I'm trying to get assistance from the grant administrator on how we can distribute that and what we need to do.
Because
And
the
I've
guy
had a
from-
little struggle of getting, information, so.
Because they got it from the city too, didn't they?
No,
They get,
yeah, I think if the city actually, I guess I need to ask that question, you know. We can't duplicate, but if they had it above and beyond expenses, then we should be able to help.
Yeah, so that.
And each food bank that we, or program that we would be able to grant funds to would have to meet that LMI for their community. So like, unfortunately, the county overall does not meet the LMI standards. So, Hillsborough's food program will not qualify because they don't meet the LMI for Hillsborough. So we are going to, I mean, Peabody's qualifies if some of the other communities are doing anything. But I just don't know how successful we're gonna be able to be in awarding those funds, unfortunately, so. It would have been a lot easier if they would have let the counties go ahead and do their part and then decide to go back and award the cities, because we could have, it kind of made us change course right in the middle, so.
You know, it would have been nice if they wouldn't have excluded farmers. We had a few of them in there that were.
So anyway, just try to spread the word that those funds are still there, and I'll get you a firm number about exactly what we have. It's kind of hard to do because we've requested funding for certain parts, and it depends on how many receipts that the businesses have turned in and so forth. You know, I know the amounts that you've all approved, and so that's what I can give you is the amounts you've approved out of the total, which would be the balance remaining for
But
award.
If they had like 5 awarded and they only showed 3 receipts, they're only gonna get 3.
That's correct.
Yeah.
Yes. Okay. All right, we do have some early checks today, and the majority of this is reissuing our July payment to Verizon because they never received it in the mail. So it's kind of odd because some of the checks were processed and some of them weren't from that. But anyway, so that's what a lot of these are. And-
Now, will you put a stop order on the others?
Yes, we did stop them the other day.
Does that cost us so much a check?
Yeah,
Yes, it does.
probably $15.
I think it's more than that,
More than
actually.
that?
Yeah.
Oh,
I think it's 25 now.
We try to wait as long as we can, you know, before we do that, but also the phone companies don't
Yeah.
give you much latitude as far as that goes, so,
You
anyhow,
know, our faith in the post office.
there you go. So the, I guess, there's a sheet of the cover
Might as
sheet.
well, you should have.
Yeah,
cut back
and
on
the
post-
total-
Always do it, get a check out.
6,718.02.
Yes.
Okay.
She's got,
Just threw it.
Here's a motion to, or I'll make a motion to approve the grand total payday for the, what was it, mainly Verizon.
mainly, but there are other,
Yeah,
there are
grand,
other things.
just leave it at grand total payday of $6,718.02.
It's not a payday,
Yeah,
just extra checks.
You wanna say payables?
payables,
Yeah.
total accounts
I
payable.
second that.
Second by Randy. Any other discussion? All those in favor?
Aye.
Aye. Here's a cover sheet. Unless anybody wants to see this. It's all in a packet, but.
See it?
No, buddy,
Okay.
Dave, coming back.
I trust you.
I do have some salary sheets, we could do those.
All right, so we have a salary change for Fraser, Nikki Reed, from 2611 to 3877
For money.
per month, interim. Have a salary change for the ambulance for Charles Kinney from $15.25 an hour to $15.50 an hour, 1 year raise. Salary change for the ambulance for Evan Moore from $0 to $15 an hour, full-time paramedic. Salary change for ambulance Camel Primer. From $0 to $15 an hour, full-time paramedic. We have a salary change for emergency management and health department, Marcy Holt, Osler, from $27.73 a month to $28.30 a month, 6-month raise. We have a salary change for communications, Ivy Jillison, from $14.62 an hour to $14.90 an hour, 1 year raise.
do have, and you all should have those on the table, of transport fuel bids.
Looks like EPS is low.
Since we have the virtual meeting, would you be willing to read those out so that people on the call know what the bids are?
So, we have a bid for transport fuel bid from EPS at $11,164.30. One from MFA of Oil at $11,461.45. And we have one from Cooperative Grain and Supply for $16,798. Just looking like the quantities are all the same. Low bid is apparent is EPS, so I will make a motion to approve EPS for the transport fuel bid. Second by Kent. Any other discussion? All those in favor?
Aye.
Okay. So we have, the next thing that I have in the packet are the voting delegates for the KAC and then also for the K-Camp annual meeting. And if you are ready to make a decision today, that's great. And if you're not, I think we can do it. If I turn them in next week, they should be okay. K-Camp is requesting by September 30 and KAC by October 5. So I don't know if you're ready to.
So anybody chomping at the bit to be on there?
Is that all the same day, everything?
Yes, everything is the same day. They, 3 o'clock is anticipated start time for K-Camp. And the, let's see, can we go back to that? The KAC coordinated that to where they would allow time for the affiliate member groups to be able to meet, so. That would be,
I've never sat all day behind the computer. I don't
and
know.
if you'd like me to set it up in here, I
It's
can
already
set it up in
done.
here for you, but I just need to know ahead of time.
There'll be a go-to meeting just like we do for something.
Yeah, yes, uh-huh.
Is it go-to or is it Zoom?
I'm not 100% sure.
Yeah, one of the, well,
It's-
something just like that.
Sheesh. Chris, it's not right there where I thought it would
Top of
be,
you.
sorry, there it
Yes.
is. Okay, so the regular, there, it looks like on the 14th, the governor speaks at 9 o'clock. The KAC business meeting is 9:30 to 10:45. And then they have some awards, there's a lunch break, and, short lunch, maybe not. Where's the, yeah, there is a lunch break. And then, it just looks like they're giving overviews of just different projects that they have going at the state level. And then at 3 to 4:30, you see at the very end of that, you have the K-Camp and K-Work business meetings, so. So they have a plan for it in their schedule. And you could appoint, we could register, whoever is wanting to go, we could register you, and then you could do you could appoint somebody for the morning to do that meeting and somebody different for the afternoon if the all day, is an issue, so.
That's a
I
thought.
think we've always had 2 different delegates, one for K-Camp, one for KAC. I know I was for K-Camp last year.
So they ask for a delegate and an alternate.
For each one.
Yeah.
Well, I'm gonna take the day off, so I'll be available.
What's news for
Yeah, I got something.
Take your pick then.
Or both. delegate for both?
Yeah. Go ahead, nobody else was it?
Recommend alternate.
Okay. I'll nominate Randy to be the delegate
I'll be in the office.
For
You wanna be
KCAM.
the alternate there?
Yes.
in KAC, and Dave to be the alternate on both.
Second.
Second by Kent.
Got two screens there, which one to see?
Any other discussion? All those in favor?
Aye.
5-0.
Okay. I'll fill these forms out later and try to get you to sign them. Some of them require signature and some don't, so. Okay. I do have an FMLA approval. If you want to go into executive session and look over the information, you can, but this is an employee that does qualify, and it is a situation that you're already aware of. And so I just need a motion and a vote to approve FMLA for a qualified employee, unless you want to go in and talk about it. So,
I'll make a motion to approve FMLA for the qualified individual.
Problems?
Yeah,
I'd second.
Second by Harvey.
we've already talked about it.
Any other discussion? All those in favor?
Aye.
Aye.
okay. On the agenda, you do have to prepare an employee review or performance review, and that's for Josh Hausman. He's at his 6 months as the director, and so you had said when he was hired to be reviewed in 6 months, and so we have not prepared a raise or anything for him based on waiting for you to do an evaluation. So I've got a form for you to use, and you all can talk together and prepare his evaluation during that executive session later, and then we can schedule a time to bring him in and discuss it with you on another meeting.
Okay.
So that's what that is. And then I do need to ask, we have 2 interviews today. The third applicant is not able to be here today, and so they are available. They gave some alternate dates, so I just wanted to see what works for the commission. So that would be 17th, 18th, or the 21st. And the 21st is a regular meeting day, so it would be Thursday to Friday this week or Monday.
We'll just do it, we're gonna meet there.
Okay.
Yeah.
Anybody have any problems with that? Regular meeting day?
And they can be available whenever we end the meeting that day?
I believe so.
Okay.
Okay.
Does that work for everyone? Okay.
I think that'd be the consensus.
Okey-doke. That gives me the direction that I need. In your packet, you do have an application or an agreement here for a grant for WIC actually. And I think that since Deidre's gonna be here later, she's on lunch, but she'll be presenting for her ELC grant and also for her Spark projects, that I think I'll probably just have you wait to prove that agreement until her time, if that's okay.
Yeah.
Okay. But she did send that ahead of time for WIC. So that's another action item that will need to happen.
I did send you an email this morning, if you would mind forwarding it to the rest of the commissioners.
Okay.
Did you say you're forwarding it to us?
I have Tina forward it, so I'm not,
Okay, I will
It's
look
a-
for that, forward it,
it's
and
a-
that's a no reply.
PPE,
Okay.
just so everybody's aware, some PPE expenses that I know that it was expressed that everybody'd like to know what was being spent, so I was making sure that it got shared.
So from Randy.
Okay.
Yes.
That's about it.
Okay, are we, I'm finished with admin, I'm ready to move on to the copier bids if you all are.
Yes, I believe so.
Okay, I do have paper copies too.
This is the one that gets used all the time.
Yeah, we've had our copier, I think over 10 years, and so here's this. If anybody needs a paper copy of that. Our current copier is through CVS, and they've been great to work with. And like I say, we've kept our copier about 10 years, and we're hoping to keep the next one about that long. So I've given you different options here. So on CVS, their actual, if you do a lease with them, a lease purchase, it's actually a sub-zero rate. So we would pay less for the copier than if we bought it outright, if we do a lease with them right now, lease purchase. And that's because the copier company is giving incentives to that lease company, to that financial organization. And I'm not quite sure who it's through, I didn't ask, but it would not be a local,
US
lease.
Bank.
Okay. Yeah, she's probably, Sherry's really good at putting everything on here. So, anyway, so I gave you, basically I've got the bid sheets, but also in your packets, we did a kind of analysis of 10-year cost of ownership between all three options. And so we would, we had looked at this quite a while ago before COVID, but we've been nursing our copier along, and just pulled it out again and had everybody renew their bids. But so with CVS, they have a 36-month lease, and then we have a service agreement, which is an annual, and that it includes up to 60,000 copies a year. And then the overage costs, if we would go over that, is shown. 360 document solution. The only option for lease that they had was a 63-month. Their annual service agreement is shown, and then the Konica Minolta is shown. They have a 60 months also, and then their service agreement is actually the one that they gave us, it said was a one-rate platinum, which I would think would be no overages, but yet they provided a $55,000 a year, 0.0071 cost if you have overages. So I was a little bit confused about that, but my recommendation and preference would be to purchase from Century Business Systems and to do the 36-month lease to get a cheaper price. The overall cost of ownership over the 10 years is lower. That's the low. And then we would own that and have to figure out what to do in 10 years.
Do we run over that number for copies?
Pardon me?
Have we ever
Yes.
run over? We have.
Yes. Mm-hmm. And on my 10-year cost of ownership, what I did was I also put potential overage, because sometimes maybe we'll run 75,000 in a year, and so I figured it at 80,000 just to be conservative. So I'm hopefully overestimating what my cost would be there, because I put in the service agreement, and then also if we had an overage, what that potential overage cost would be based on the rates they gave us. So.
Do these include cartridges
Yes,
in the service agreement?
yes,
All of them do?
yes,
That's a big expense.
yes,
Yeah.
it is.
And they all do color?
I did not, ask for color, this is not for color. It'll scan in color like we have now, but, we don't do a whole lot of color copying. We can scan it in color and print it out on a color printer if we need to, or, we can,
I didn't know you could buy one without color.
what's that?
I didn't know you could buy one without color.
Yeah, we're buying as basic as we can.
How's their response time when it goes down?
Great,
Okay.
yeah.
Usually that,
And they work
That's
real,
the value.
they work real well with our IT. We've worked with some of these other companies and they're not quite as great on the IT side because we network these in to our network. So it'll talk to our computers.
They are to Wichita.
Oh, I don't even know, I'm sorry.
I know the other two come out of Wichita.
They probably are. Okay, let me see if this says. Manhattan, Abilene, Salina. And 360 has Wichita, Kansas City, and Salina, and then Conica Minolta is,
Wichita.
I'm assuming, it doesn't really say on here. Location is starting to be an obsolete thing that you don't pay attention to because everything's done online now. But anyway, this one doesn't say.
well, this is your recommendation. And then looking at the long-term costs along with the overages projected, it's the apparent low bidder too, so.
That's the best deal.
So I will go ahead and make a motion to approve the 36-month for Century Business Systems. Second by Ken. Any other discussion? All those in favor? Aye. Aye,
Okay,
Bill.
thank you.
Done with that agenda item.
Yep.
Moving on.
Good morning.
All right.
Good morning.
Vicki.
Let me fix that, we need to fix that microphone a little bit, no one will be able to hear you. That needs to be facing you. Here we go. Let's see if that works.
You ready for this?
Am I ready for this? I don't know.
Yeah, you are.
I have a post-construction neighborhood revitalization application that needs approval. It's for an ag building, their cost is $51,578. I need to tell you who it's for.
Post-construction for what?
Neighborhood revitalization.
Okay.
It's for Leslie Weedle on 1230 Alamo.
And the reason why? Didn't know about it or what?
I didn't know about it or was confused about the process. I'm not sure. He brought it in and I believe he thought he had to turn everything in all at once. So,
Board, this is something that we need to look at, I think. I mean, that's just down the road, how far we're going with it. Something that we have control over for the future. It's whether you see the need into it. At the time we did it, we thought we've seen the need. We've come back, dropped it from 10 years to 5 years, and it's still at 5 years. And so, just giving you pointers that, you know, it's in our control. And we saw on the budget, I'd have to pull the budget out, but exactly it was 180,000, 200,000, or was it that we
I don't know.
refund.
There's a lot in there.
Yeah, that, I don't remember whether it's more than $1 million or so of tax that we have to refund, we have to make sure we pay that back, so. Food for thought.
I think we just renewed that in the last couple of years, haven't we?
Yeah.
So it's got several years to go yet.
No, you can,
I don't think you've really done
Yeah.
any action as far as, you just let it continue.
Okay.
So you have, I
I
don't believe
remember
you've
bringing
taken.
it up.
yeah,
Yeah.
Sometimes, it's been,
Right.
maybe, it's been over a year.
Yeah.
2 years.
but we are in control of it. We can designate. I think the only thing that I know of in the thing that you have to, would probably be stop it at the end of the year or continue it each year at the first of the year. I think that's it. Or for your tax purposes, is that, when can it stop or start? I mean, any.
Well, I mean, I just think so that people know that what you're doing,
Yeah.
setting a date is good, but, you know, our tax process starts in July.
July.
You know, so, basically, because we have to, in June, because we, receive the value from the appraiser's office, and that's what we start with, for budget purposes, and then we certify it again in October, and the tax roll is generated in November, so you know, it's kind of irrelevant when you start it and stop it, you're not gonna necessarily be in line with the tax year, because,
Okay. But your school boards, your schools, your cities, I think Hillsboro's opted out, if I remember right.
I don't have all that in my head as far as who's in and who's out, so,
Saying yes.
Yeah, but I know the city of Hillsboro's Milwaukee's not included. There's
Yep.
a school district not included either, but I don't think it's Hillsboro.
Probably need to speak up a little bit louder.
Oh, okay, sorry, I don't talk very loud to begin with, so. Yeah, I know City of Hillsboro's mill levy's not included, and I know there's a school district. I don't think it's Hillsborough School District that's not in it, but off the top of my head, I don't know.
There's been a whole, to me, there's been a whole different outlook in our tax world from when we started it to what we see today, so.
This one here would require action by the board.
yes, because they, are requesting entry into the program after they've already built. And
Mhm.
that's, you know, one of the stipulations is that you apply ahead of time before your building project. But the, every single late applicant that has come before the board in the past has been approved to
We'll say
participate.
We've set precedent.
Yes. Yeah, yeah.
It's just happened a couple
Correct.
months ago.
Yeah.
Mhm.
Well, then we need to set something that says if it's not pre-approved, it won't be approved. or
You could,
is that-
you could
We need
do
to set
that.
that direction after this one.
Yeah, I mean, either that or just sign it first of the year or something to that effect, whenever you can do it at any time, like Dean.
Well, it's
just said.
already existing in your plan, but if you have been taking a different action each time, it'd probably be good to have, an action of the board to say,
Yeah.
like what you're talking about, that, after the state, no more late applications will be
And
allowed.
that's something to be. The reason why we allowed it is because it's just, if the planning and zoning does not let them know when they come in for an application, but I think planning and zoning's doing that now. So, and then what she just said, is the clarification whether you wait till the end of the project
Yeah.
and send all your bills in with it, or
Right,
has to be a problem.
I thought planning and zoning put a letter in when they mailed the permit out, and I know there's something on the tax bill or with the tax bill when they're mailed out about the program also.
And it does
I'm
say
not sure
on
where
our
the
website.
confusion
Yeah.
comes from on
Yeah.
where they think they have to turn all of it in at once. I'm not sure.
Well, on this one here, I guess I'd go ahead and make a motion to approve the goal development, for Leslie Weedle.
Second.
Second, by Randy. Any other discussion? All those in favor?
Aye.
5-0.
The other thing was, I think Tina told you guys last week, but we did advertise for a full-time data collector, another full-time data collector. It was a position that we used to have, that was filled, and then since we have 2 new data collectors, we're kind of struggling to keep up. When we lost some employees, we kind of lost a lot of knowledge and experience, so I guess as an office, we thought it would be better to have an extra person, and we talked to Tina and we had it in the budget, so we advertised for that. I guess I was just letting you guys know about that. And then I do have to talk about a personnel performance in executive session, if I could.
Well, we're gonna act on the neighborhood revitalization
As far as, do we want to do that now, or do we want to wait until like January, March, or?
I don't know, it just seems like all this comes to us after the fact.
Yeah.
Okay, I mean, if
Let me ask one more question. How many comes through on time and like they're supposed to?
I'd say 90% of them.
90% does.
Mm-hmm.
So it's getting out there. Must be getting out there then.
And I'd say not everybody, it slowed down on how many actually apply for the program itself. I'd say about, I don't know, 60 or 70% apply for it, 40 to 30% filled without neighborhood revitalization at all. The cities, I don't know how much the cities really tell. But we still have the program where.
That's the other thing too. Within the city, you don't apply to the county. That's another.
Yeah, different jurisdictions.
Yeah.
Well, none of the cities offer a neighborhood revitalization program anymore, so they do apply on this one now. The cities used to have their own program,
Correct.
and now they don't. They've expired.
But now we have new city clerks, and if new city clerks don't pick up on it, why then they don't get told unless they.
Unless they already know,
Yeah.
yeah.
Okay. I'll need that, I mean, somebody thinks we need to make an action now, or have it scheduled for a later date, so that.
You're going on just either you get it in on time or don't.
Right.
I think we should make an action on that. I don't see no problem with that. So we know that we don't come up here for this.
You want to make a motion?
I'd make a motion that we move to start October 1st, not accepting any late neighborhood revitalization plans that pay for payment.
So the first of next month.
Yeah.
Got a motion? Got it. Well, second. Got a second by Kent. Any other discussion? All those in favor?
Aye.
Now you got your answer on October 1st.
Yeah.
All right, we already have on the agenda for performance review. Is it possible that we could add that other performance review in at that time?
Or the personal performance executive session.
I mean, I know it's two different individuals, but that's
You're just
still-
talking about doing it at the end.
Yeah. So we're not taking anything out of it.
You'll still have to
Virtual
click
meeting.
in and out, but if you want to do it all at the end, that's not a problem. You can.
Is that doable for you?
Yeah, I know, whatever works for you guys.
I'm just trying to limit the amount of times that we
Yeah.
jump in and out of the virtual meeting.
Yeah, that's fine.
Okay.
I think that's it. I had.
Say what?
I said I think that's all I had for right now then.
Okay. Good.
And we'll just get back with you when they're ready.
Okay, thank
Okay.
you.
All right. Thanks. All right. Move on to Deidre then.
we're a bit early.
Okay.
I can call,
Yeah, I will.
because we were kind of,
Let's take a short recess.
want to do that?
Yeah.
Okay.
What, 10 minutes? Is that what?
Yeah.
10 minutes. Recess for 10 minutes.
Okay, so we're gonna recess for 10 minutes.
This conference is no longer being recorded.
Have a bit better timing. All right.
This conference will now be recorded.
All right. Resuming the meeting. Deidre is on now, so we're going to move on to our health department.
So we
Okay,
we have not done the WIC yet, Deidre. I figured since you were gonna be on that I would leave that to your time.
okay, so, since you mentioned that, I had sent the WIC budget to you. It's needing Jonah's signature. If you look at the cover letter that was sent, I believe there might have been a typo from the state, because that should be the federal fiscal year 2021. So if you look through that, it will, there's two places for you to sign, Jonah. The very back sheet of the attachment, it will show you how much of the allocation goes to Morris and Chase County, and then how much comes to Marion County. So basically, the allocation for Marion County is $55,671, with $2,133 for breastfeeding peer counselor, and then Morris and Chase County would have $40,517. And the assigned participation, 73 for Marion County, and then Morris would have 73 and Chase. Do you have any questions?
Anybody have any questions?
Assigned participation, what does that mean?
That means we have about 73 participants that are in the WIC program. WIC stands for Women, Infant, and Children. So it serves pregnant and breastfeeding women, children, infants and children under the age of 5.
Okay, that's just an average, or?
Yes. And the participants do have to, they get screened every six months, height, weight, hemoglobin. Some of that has been during this COVID situation. We have done a lot of that via WIC has waived the height, weight, and we have done a lot of that just by phone conversation.
Okay.
We're getting back to in-person visits, though.
This all also provides assistance for specific types of groceries, correct?
Yes, it's a nutrition program, and depending on your category, like pregnant, breastfeeding, postpartum, or infant or child, depending on the ages, you get a tailored food package, which includes, like, at a certain age you get milk, cheese, at a certain age you'll get peanut butter, they have beans, they have vegetables, I think fresh. The cereal has to meet the standards. It can't be sugar-free and has to have a certain, it can't have sugar, like Fruit Loops isn't approved. So, and it has to be iron fortified.
Okay.
They get juice, eggs.
You just need the chairman's signature?
Yes,
I'd make a motion
there's
to approve that then.
2 places.
2 places.
Okay, so there was a
Yes.
motion to authorize the chairman's
Yeah.
signature.
I'll second
Motion by Randy, second by Dave. Any other discussion? All those in favor? Aye. 5-0.
Deidre, does all of the retailers in Marion County, are they WIC providers?
The grocery stores, yes.
Okay.
And they have to have certain, like, they get monitored. Our dietitian goes out, and then she also has a annual training with them.
Okay.
Okay,
ELC.
the next thing is the ELC grant allowance, and I sent the information with you. The memo kind of describes it. The first memo actually went out to you guys on the 27th of July, just indicating that I was applying for this. The ELC is KDHE COVID-19 staffing and infrastructure support. It was given to every Kansas local health department for the COVID response. And under this grant, allowable expenditures included a one-time salary adjustment to compensate salaried or hourly employees for their extraordinary efforts in the response to the pandemic. And the second page of that kind of shows you the budget request that I asked for. And the one-time salary actually came out of state fiscal year 2020. So Tina has that pulled up. You'll see that kind of highlighted. The salaries is in the yellow and the benefits is in kind of a golden color. The salary for the health officer is based on what the state recommended, 20 extra hours a week times 4 weeks times 4 months. And that is, I realize that as a director that we are expected to work more. However, this is not a regularly occurring event, we hope. Usually I do put in extra hours, and very rarely do I have a 40-hour a week, but this was unusually increased during the start. Also, if you notice, I have our nurse is added to that. She was basically working 2 days a week, and she now is pretty much full-time. Sometimes there's even overtime. So she does a lot receives a lot of calls in the evening. We all have on weekends that we have not recorded time. And the important thing is that we recognize these people so we don't lose them. I know that there have been already out of 105 counties as of probably 3 weeks ago, KDHE reported that 10 directors have either resigned or I think 2 had been let go. But and their staff members are kind of resigning because the workload has become too much. Also, our dietitian has kind of stepped out of her comfort zone. She's added hours to that. And I want to keep these people employed because the training that it takes is quite time consuming. Dr. Hodson has increased his as medical consultant. He's increased his time. We call him quite frequently. And then also Marcy, she stepped into this preparedness position, and several weeks after that, COVID hit. So she kind of hit the ground running. She also takes calls. She's the one that puts out this dashboard, and there have been many times she's come in and even though she does put overtime, there are times in the evening that she gets called and that goes unrecorded. So we did get, this has all been approved by the state. The next, I think I did put the next page, Tina, might be the reimbursement that the check, we have already received the check, and that explains it. I have met with Tina and Ashley, and they are determining the best way to distribute this. Any questions?
Anybody? Okay.
On this, because this will require a completely separate payroll. We want to be able to track this completely separately. And so we will be paying this, if the board approves us to move forward and authorizes us to pay it, we will be paying that on a separate day.
And this,
So,
in no way will this affect our policy as far as
no, because we're not paying out overtime per se for an exempt employee here. This is the way it's presented, it's based on a formula, and it's based on the way it was worded was the extraordinary effort. If you're not 100% sure about that, you could definitely consult with Brad when he gets here. But one thing to keep in mind, if you do actually pay out overtime hours and that's what you're paying on an exempt employee, you take away that exemption, and that person is no longer exempt, and you will be paying overtime for the rest of the time that they're employed. That's, but this, I don't believe it would cross that threshold because it's not being requested for actual overtime hours.
So I was looking.
Right, and I did talk to Brad before I even applied for this to make sure that it's kosher. So he was consulted, I think it was July. I think in that original memo, I had said that I had spoke with him, so. And it is just a one-time, it's not for overtime, and that's why the formula, like Tina mentioned, was used.
So everybody just getting a one-time check Just one payment.
Yes. There are additional amounts for the 2021 state fiscal year, but Deidre explained that those would just be charged against the regular salaries. She will report that on the grant, that those salaries are being paid by that. So it's not additional funds that we'll be paying out in the future. Is that right, Deidre?
That is correct, because typically Wanda works about 16 hours. So I figured that she's working about 16 more hours, and those extra 16 hours will just come out of the salary that we pay her.
So we would normally be paying her that and just paying it out of your budget, but instead of paying it out of your budget, it's gonna be paid from the grant. Or
Right,
reimbursed by
it'll
the
be,
grant.
it'll come out of, her paycheck, but that 16 hours of it will be, in a sense, charged to the grant. And so when I do my quarterlies, I will show that, and that reimbursement will come toward those 16 hours. Does that make sense? It's basically like any of our grants. I charge a percentage of Wanda's time to IAP, and this will be just charged to the ELC grant.
Okay.
And same way, like Dr. Hodson, typically we pay him $150 a quarter, but as you see on that request, we are going to pay him monthly through the end of December.
I don't doubt anything, I just wonder if we ought to wait for Brad on.
I'd like to, I'm a little concerned about duplications and different things. I'm just concerned, I'd like to hear from Brad.
From what I read in there, I mean, it did say it allotted for one-time payment, and I just wanted to be absolutely sure we don't breach any of our own policies.
Me too.
Yeah, I do believe Brad is planning to be here today, so.
I'm having a hard time getting it through my head. Well, I've got it through my head. I understand where it's coming from. But I don't have no extra pots to go out when a snowstorm hits, floods hit, and pay my extra people that work that. I don't know. I'm having a hard time. I understand the amount of time. The meetings, calls was on Saturday and Sunday. Some of that was through that they attended. We didn't know, and I do agree, we didn't know what was coming, to the best of our knowledge. So I would have to agree, maybe I need to hear something from Brad to, I don't know.
And I don't know that I'm concerned about paying them the money because we can't pay other people because they don't have the pots. I do know that Deidre's very aggressive as far as applying for grants.
Yeah.
And honestly, I don't know if there were grants available in other departments that they didn't apply for. So I certainly wouldn't want to hold her back for going above and beyond by making sure that she gets this grant. I just want to make sure that we're not violating our policy, is my only concern.
Yeah, I don't want to open up Pandora's box, that's all.
Right.
So is that the consensus of the board to wait and validate it with Brad before we take an action on it? All right, man. Is there any reason why we couldn't do that?
No, I don't think there's a reason you couldn't do that.
No, like I said, I don't doubt you, Deidre. I just being a little cautious, I guess.
Yeah, and that's fine, and that's why I asked Brad in the first place. And you know, I realize, like, during flu season, I always spend extra time. There are times, you know, regular times of the year, I have extra hours, but this is not a regularly occurring thing, I hope. And so, and I will tell you, I mean, I'm continuing to spend extra hours because I feel like I want to do the county justice. So I'm, you know, and I want to keep my employees because they are doing an awesome job. So anyway, Tina, is it okay then to move on to my Sparks request?
If the chairman's ready to move on.
Yeah.
Here, as,
Okay.
let me pass out what you sent this morning.
Okay.
Do we have another one?
There should be
Here's one,
five
here's
of them.
one.
Okay, okay.
I did want to update you a little bit. We have not sent out a press release, so as of 7:30 this morning, we have no changes in the total number of cases, but the active cases is down to 13.
That's awesome news. Thank you, Deidre.
So, yeah, and I do want to remind you that the KDHE in their numbers, when they base our positivity rate, they only count the PCR or the molecular or the confirmed positives. The probable cases are not included in that number.
Okay.
And something, you know, I'm trying to work with the nursing homes, and I will tell you that I've asked KDHE where CMS gets their number, and they are checking into it because I know they have a lot of regulations that they have to follow based on the numbers CMS is providing them for Marion County's positive rates. Okay, do y'all have a copy of my
Yes.
Spark request? Okay, basically, I was told that 80% of my salary, I charge some of my other salaries or portions of that salary go to other grants, but I plan to charge 80% of July through December to the Sparks grant. So you see that there. Erin Hine, she does our communication, our Facebook. So you'll see the figure there that I used, 20 hours times 4 weeks times 6 months. Marcy, hers, I charged 2 hours times 4 weeks times 6 months of overtime. And that's simply for the weekends when she has to do press release. The 2 nurses that we have hired to do the investigations, one works on weekends, so you'll see that her hours will be a little bit less than Charlotte does work probably up to 32 hours a week. Now, down when you get to the lab tech and the RN advisor, I did, if you all may have heard that Public Health got their own kind of coronavirus relief fund, CRF Spark funding. So I did apply. I put in for $75,000 to cover those two positions that I had listed, we did not get that grant. And I know some other small counties did not get it, so my thoughts are that that will go to the bigger counties who are asking for more than 100,000. But anyway, if you remember, we kind of have been talking with Tabor to provide that testing for the community. And so through those talks, we would provide the lab tech and also a nurse advisor. Those logistics have to be worked out. But you can see there would be the lab tech we'd hire at about $17 an hour times 14 weeks at 40 hours a week. And I'm envisioning this person to be available to collect specimens, also to transport specimens as needed to KDHE. The RN advisor, what I had talked with, but again, the logistics, maybe 2 hours Monday through Friday, and then 4 hours Saturday, 4 hours Sunday. So that would be $25 at 18 hours times 14 weeks. And so you see that figure there. The benefits would, at this point, Capers is myself and Marcy. The travel time is mileage to Cahill, and then also the toll. I did ask for some PPE, but that could, if we can get that, Randy's already ordered, then we wouldn't need this, but this PPE was specifically for the lab tech and the nurse if needed. If you go down to the fit testing equipment, what that is testing equipment so that people can be fitted for an N95 mask. I put in for 3 of those. The health department would have 1, and then and I've talked a little bit to Travis. I haven't talked to the hospital, but I thought if we had one either at the EMS or at the hospital in Hillsborough and Marion, that way they would be available to test EMTs, anybody that needed testing in that area for the N95. Then that equipment is also included in that. But in the future, those entities would probably have to buy their own, like the probes and the push nuts, the sodium chloride tablets, and the alcohol supplies for that. Sophia testing supplies, I talked to Rusty on that, and I believe Tabor was going to order about 1,000 extra. So I didn't know where that funding is actually coming from. The portable vaccine coolers, that is something that if we need to distribute vaccine, and we could actually use those for our flu clinics. So it would be for the special vaccine, but also, it's like we wouldn't just be buying it and then putting it on the shelf after this is over. So the vaccine coolers, 3 of those, and then 3 data loggers. The data loggers are basically the thermometer to make sure that the coolers are keeping the vaccine at the appropriate temperature. So with all that added up, that would come to about $155,098. Do you have any questions? Now we do have like monthly expenses, I think, like our internet that go to risk management, but I was thinking that those regular expenses are, Janine will present those. Tina, is that correct?
Some of those smaller things that are already in your budget, if they're under $150, I don't know that they're gonna keep going to risk management or be presented for Spark reimbursement.
Okay.
What was the allocation? I don't have it in front of me and I'm looking for it, but the allocation number for Sparks for, we had health, we had USD, schools, we had,
I think they put, they changed ours, I believe, to 130, but at that point I thought we might get that extra money from the public health, CRF grant. And the lab tech and the nurse advisor, those two positions, I need to work out, we need to work out with the hospital, Hillsborough Hospital, and also Tabor as to, in a sense, who would actually hire those and pay for those. So those two expenses are kind of a question mark. Does that?
So you're saying that the allowance from this Spark spreadsheet that was provided, and the difference is those items?
Well, yeah, and because that would include like the travel.
Yeah.
And then it would take some out of your benefits, obviously. Not a whole lot, because the only thing that would come out of those wages would be the FICA, unemployment, and workman's comp.
The only reason why I'm asking is because this is the first one to hit us, and I don't, then the other ones expected they were had this number, and well, no, some of that already went over here, so trying to make sure we don't reallocate, take it away from one that wasn't expecting to have any taken.
So,
yeah.
Well, and I mean, I'll work with whatever, so I think like Joni, you're saying is you don't want to say, yeah, we're going to do this. You want to look at everybody's, and that's fine. I just wanted to give you an idea, and to get someone hired, it may not even be 14 weeks, so all of this is kind of those two positions, and the travel is questionable.
So did you?
And I don't know if in the county departments, that Janine, I don't know if the salary portion was coming through that.
The only things, so on Marcy's, that looks like a duplication to me, because what we have been submitting, we have not so far submitted any actual salaries. We have only submitted unbudgeted, because that's what we were told initially. So we have submitted for reimbursement previously the COVID leave, time off expenses, and then the overtime expenses. I'd have to look and see, as far as Marcy's, how much of hers has gone to it.
Okay,
It could have been
and
some
then
of her
I
regular
was,
time.
On one of our meetings, and I can't remember how far back it was, but it was my understanding that if we were spending a significant amount of time on COVID, even though my salary was budgeted, I could charge it to this. Is that correct?
I believe that that is the, I think that is what the current guidance is, but we'll check with Scott again on that to make sure, because they keep changing their mind.
Right. And, you know, my salary was in the health department budget, so
Right, it hasn't been
I'm
paid
not
through.
quite as worried about that. Now, Aaron's salary, you know, we don't have childcare licensing anymore. So that's kind of a new, so she took over the Facebook. And then, of course, the other two nurses, they were hired on specifically for this, so they were not in the health department budget.
Yeah, go ahead.
And so DJ, I have a question for you. What kind of steps for accountability is involved here as far as a lot of these things that we're doing are kind of projected? And what if they don't happen? What if you don't need all these extra hours? What if these people don't use all these extra hours? Or you don't need all this travel or all this extra PPP? How are we gonna track what we actually need, or are we just gonna spend it while we have the opportunity? I mean, is there something in place for accountability like that?
That stays right there.
Well, and that's where, like, we're gonna have to, yeah, if we don't, I mean, because those two nurses, if they don't have, you know, they may not have that many hours, but then again, they may have more. So that's where it's gonna be kind of touchy. And I think that the task force and you guys are gonna have to, like, if we see in 2 months we aren't spending that, then we need to make sure that it goes to where it is being spent.
I guess that confuses me a little bit, but
You need to maintain some flexibility, so you can
I-
approve initially.
I understand flexibility, but I was also asking about accountability, even with flexibility.
Right, and those, for accountability, any invoices that are spent on this, they're going to, of course, anything over 1,000, you commissioners are supposed to pre-approve as far as from the direct aid plan as we move forward, projects over 1,000. But, so once we have that approval documented in the minutes, when we receive invoices for these things, they are sent then to the accounting firm. They'll be sent to the accounting firm who's also double checking everything, and then they'll come back to the board as a payment package for you to get final approval on. And that all of the documentation has to be submitted because this is subject to a single audit, and we have to be able to show that what we have spent and have the documentation that shows that it is eligible. So.
And Diane, I do keep I have a personnel allocation spreadsheet that I have like my employees here at the health department are on, because I have to keep that to make sure that their grants I don't go over 100% spent, you know.
Okay. I was just wondering, because it's an awful lot of money here, in addition to all the others, and I was just wanting to make sure that we were keeping it under control.
Yes.
I got a question, this is Dave.
Mm-hmm.
EMS is here, so maybe he could explain too. M95, $59,000. Is that a viable thing that we need?
You're talking about the fit testing?
No, the portable fit the N95 mask.
Now, you mean the port account?
Yeah,
Yes.
the machine.
Yeah, what that is, it's a machine that hooks up to a computer program, and then it takes the person, you put on one style or one model of a mask, and it's hooked up. You see probes and push nuts. You hook it up to a tube. It takes the person through, like, you stand, you read, you smile. I can't remember. I think you bend over, you turn your head. It takes you through a sequence of movements, and then it measures the fit. Basically, like, is it sealed? And
do we need 3 of them in the county or 1?
Well, that's the thing. We could just have 1, and then people would have to check it out. But I thought for ease, I mean, we could even have 2, one located in Hillsborough, one located in Marion, you know.
And these are for the hospital people and the EMS people mostly?
Yeah, the hospital, I mean, I think it could be available for checkout to, like, nursing homes if, you know, if they don't have a means to do that. I think some of them have gotten means. There's a real easy test that you can do, but this actually it's a very good way of testing because you can keep those records, and it's fairly reliable.
Yeah, I would think people would go to the machine, not the machine go to the people, because it's probably delicate and takes, not everybody can operate it.
Right now, what we do is our preparedness region has it. It's stored in Sedgwick County, and we have to do annual fit testing here at the health department. So we schedule it, and then we do it here. So it is portable. It is via a case.
It's a big suitcase, Dave.
Yeah, well, I'm sure
It's about like,
Yeah.
the one we test on is probably 2.5 foot by 16 or so, and that's what we
Correct.
test on for. And this is for same as your mask, fit mask, and that's what this is all about, correct?
Yeah.
Yeah.
Correct. Yeah.
It's
And
a
usually it takes, I don't know about you, Randy, but like every year I'm fit tested, I get a different style of mask, probably because I'm gaining weight through this whole thing. But, you know, sometimes people, like, we have some employees that they have to go through 6 different masks before they find one, or they may not even find one. So then technically they have to wear a different style of pepper. So
This is to completely get into breathable air.
So is all EMS hospital and hospital employees utilizing the N95s?
Basically, if we're mandated at the
they
house,
should be, you know,
For sure.
you have to be fit tested to assure that the N95 is the correct one for your face.
Gotta shave all this off too. I used to have to put them on Cargill. And we used to do fit testing all the time.
Yeah, you can't have a
Curious.
face mask.
Yeah.
So this is gonna be something that's gonna be utilized, I mean,
In the
ongoing. This isn't just a pandemic deal.
Correct.
Okay.
Right. This is something that I think at least I would say we should have. It would be nice to at least have 2 in the county, because your law enforcement could use it, could check it out. You know, it could be used by different agencies, firefighters, if they assist in transport, you know. Because really, technically, if you wear an N95 mask, you should be fit tested.
Okay, thank you.
I have a question about the payroll expenses that are shown. It looks like they're similar or the same as what you put into the ELC grant. So if the ELC grant is approved, it looks duplicative. Is that to where you would get it from ELC instead of Spark?
The ELC, like, what do you mean?
Because you were saying 20 hours a week times 4 weeks times however many months, and that's exactly the same as what your ELC grant is. So it's my understanding you could do it for what, if it's paid through ELC, you can't submit it then for Spark.
Okay, now on the ELC grant that I sent you, I thought I only had Wanda on there. For 2021.
This is Sparks for 2020.
So either way, however if it's approved, it would need to just be that it's non-duplicated.
Okay, because the ELC grant is the one I just presented before this. And if you look at 2021, I just have Dr. Hodson and Wanda.
Okay.
That is top of the first page. That's why I didn't put Wanda in the Sparks request.
Okay, so you've already looked at that.
Yeah. It'll probably show up sideways.
Yeah, the ones up at the top are 2021.
There. No,
No,
next
next
one.
one
Up.
Never that one there.
There. It 2021 stops with the unemployment for Wanda.
Okay, and that fiscal year starts October 1, is that right?
No, that fiscal year actually started July.
The 2021?
Yes.
So it'd be 3 months. No, excuse me,
Right.
6 months.
6 months.
So the 2020 one-time adjustment is only for 3 months?
That's only for 4 months. That's March through June.
Okay.
Because the state fiscal year goes from July 1st to June, is there 30 days?
Okay.
So, and then to confuse things, the WIC is a federal fiscal year that does start October 1st.
Okay.
So that might be where you were thinking.
All right.
So do you have any other questions? I'm going to jump off if you don't.
So both requests, Deidre, both requests was approved. Your salary, you would have an extra 25 on health officer over here, and then another 98 over here on the other one. Be an extra 35,000.
No,
No.
Well, the 25
No.
would actually go to
No,
business
no.
budget.
the 20,000 is not extra.
Okay.
I wish.
It's
But
just to
that's
reimburse the
80%.
Okay.
I'm
Just part of the
thinking
payroll.
yes.
Okay.
part of my payroll, but we're just asking the state to put that money in that pot to help pay my salary.
Okay.
So that's not, no, Lord, no. I mean, I hope, I wish, but no. So.
Randy then about that when she's still on there.
Yeah, we're gonna go back to the ELC if everybody's all right with that, since Brad's in the room. Basically it came up at the one-time payment basic on this ELC of the 9817. Oh, well, I think there's more than just her. We just want to make sure we're not breaking any sort of policy of our own that interferes with our exempt employees. If we were to approve this, we wouldn't do something that we didn't foresee and have to keep paying overtime.
Well, I mean, we'd have to do it a certain way, because I know Tina and I have discussed that too. If it's a salaried or an exempt employee and you're gonna go ahead and supplement, and I use that term carefully, then that's gonna have to be done in a very specific way as a one-time type of payment. If it is in addition to an existing salary for additional work done, I don't want to make it an enhancement to the salary. I want that to be like a one-time supplemental or merit type of an event. I'd have to work through the terminology and the semantics, but got to be a little careful with that, because you can immediately turn an exempt employee into a non-exempt and go back to an hourly. That would be the biggest pitfall we'd have.
And if this is figured on a salary, on a
Hourly.
formula
Yeah.
based on a certain number of hours, weeks, months of, obviously we haven't paid any overtime, and it's not, I mean, I guess they're looking for the, if they can't even do it, what's the right?
I'm probably, before I gave a final answer, I know you and I talked about that, and I really have concerns for the employee's sake as well, if they're an exempt. And if we don't do this correctly, it will forfeit that exemption. That's a big problem for us. I can check with the Department of Labor, since this is a unique circumstance on a one-time basis, see what we can do to recognize the additional work without necessarily changing the status of the employee, because that would come back to haunt them and us in a number of ways I don't want us to get into at all. So.
Well, I'm looking at the Kansas Department of Health. And
Is that the website, or is that over?
No, it's on the.
That's okay.
It's within the packet.
Yeah.
And it's allowable expenditures. It has a one-time pay adjustment to compensate salaried and or hourly employees. But I still don't, that still doesn't explain whether or not it breaks our own policy.
If we have the ability for me to take a close look at that, I will do so. I'd really rather do that before we determine how it's going to be done. If you're predisposed to do it, then I would do it as an instruction to me to find a way that it can be done so that it doesn't create a problem like that.
I mean, is it something that could go to next week? Is that possible? I mean, I don't know what kind of time.
I'm trying to hold it up, but I wouldn't be able to give you a firm answer.
I just really don't want to open a Pandora's box. I've said that before.
I conceptually understand what's going on. I just think we need to be real careful how we do it.
Okay. And as far as the Sparks allocation request, there's no reason we have to pull that today, or is that
Well,
time
we
constrained?
that is pretty time sensitive, because anything that is an actual purchase, they need the authorization to get that done, because we have to have those items purchased and that money spent and accounted for by the end of the year. And so on your, the salary and benefits portion, you wouldn't necessarily have to do today, but the, for sure that if you wanted to go ahead with that fit testing equipment, that should be done if possible, a decision today. And
I was just kind of looking at this here, and it being basically $20,040.40 over the difference between the spreadsheet. If we just didn't have the lab tech and the travel, that would bring it back into the.
Jonah, that spreadsheet is a very fast moving target.
Right, but we need to.
It changes hourly.
But there's other departments, other people out there that are expecting a certain dollar amount, and then we'll wind up with the last person getting the short end of the stick.
I think there's gonna be a surplus, because there's gonna be a lot of things, they're gonna get money back. I mean, they don't get it purchased, or we're gonna have trouble spending all the money. So like the county, we haven't spent our CARES money yet.
Yeah, I just wonder if we ought to let the lab tech and the mileage be picked up by another one of those line items, if that's doable. That way they stay within their constraint of the, so everybody that's expecting a certain dollar amount from all these different places are getting that.
Well, like Gene said, it's urgency, we've gotta.
Right, and that's what I'm saying.
Well,
We're not hiring a lab tech today, and we're not paying them mileage to take the tests up and back today, right now.
That's what we've already spent.
So should we
Right.
approve everything
No.
except
What?
salary?
Deidre's got something.
Okay.
if there aren't that many trips, it would only be, it's kind of a PRN, like we aren't gonna send them up if there's no,
No reason to go.
no reason to go. So it's hard to really, nail that down. And as far as my salary, I wasn't sure if that was figured into Janine's portion, because the health department gets some and then the county gets some. So I didn't know if the salaries were coming out of that. So,
It sounds like it's not.
Okay.
So I just wonder if, just to keep it in line, and then we can go back to those two items later. I mean, if the other department, or the other allocated spots don't pick it up, or they leave 20,000 on the table, we can go back and put it here. I'm not trying to overcomplicate it,
I mean, if they don't use it, the money will come back to the pot.
yeah.
You just give permission to use it. If she needs it.
Yeah.
Is that right, Deidre?
Yes.
Yeah.
Or is there another way?
Before she spends it, she can ask permission this time.
Well, I'm just wondering if there's a little overlap on the planned expected plan that was sent, because we have PPE for county workers at public facing office and a COVID testing lab that's $142,000, and then you have PPE and vaccine storage, which is $99,900. So this vaccine part here isn't part of that storage, right, Deidre?
No, I don't think so, because I'm not sure.
Okay, and then construct health barriers for social distancing, PPE, teleworking capabilities was estimated at, that was like the 135 that was shown on here.
Yeah, and I don't know where, because health barriers, was that like in the very beginning? This is already put forth, right? Or is that?
The last thing that I remember we approving was the spreadsheet that basically threw out the estimated cost to the schools, to the health, to emergency. It was all just up there on the screen a second. Now I gotta go off memory.
I'm sorry.
All of those.
Cities, businesses. So,
Oh, okay, so someone actually just put those wording in there, okay, okay.
I would say on your salary, that part is the most flexible, and that part is the most unknown at this time, and it doesn't require an actual purchase or,
It's actually just refunding the budget, right? I mean,
Right.
Exactly. So if you're gonna leave anything off, I would just not necessarily approve that, but approve any items that need to be purchased or move forward on if if you're ready to do that, because that's the part where we're gonna get into time crunch. The salary portions, we can research that a little bit and look into it and just make sure that, you could almost do that overall.
You could almost do it all overall, because it's going back into the budget, it would just be less
Right.
than we would do next year.
Right. So yeah, like Tina said, we need to figure out about the fit because about the only thing I have that, is equipment or a purchase would be the fit testing. So do we purchase 3 or do we purchase 2? Or just 1?
Right, you could go with 2. I would go with 2, and then that puts it back into that dollar amount that I'm sitting here being concerned about. Because you practically at 3, it's about 20,000 a shot. roughly.
Yeah, if we can have one in Hillsborough and one in Marion.
So we went with 2, then basically approved the whole thing.
Okay.
But we still don't know what the exact personnel costs are gonna be either, so. I wouldn't approve it based on a certain dollar, except for the
basically,
purchased items.
What was that, Deidre?
so basically, I can go ahead and purchase 2 of the port account.
If they take action here.
Okay.
So I'm kind of looking at you, because you spend most of the time with the Sparks more than me. So.
Yeah, we need to, because probably this equipment's gonna be in short supply too, because the whole United States is buying right now. Everybody's got money this week.
Right.
I mean, our phone just lit up at the office last week.
So do we want to make a motion
Finally.
to approve the Sparks request for 2020? With
Got the salary benefits.
with
Port account, have 2.
amending it to just have 2 port accounts instead of 3.
And something about the salaries still being, the salaries are not gonna necessarily be that amount. It's gonna change, and so
Aren't these salaries already set? Didn't you say that these salaries were already set based on 4 months in 2020?
Yeah,
Marion
well,
works part- she
the
works hourly.
salaries that are gonna become most important to get paid through the Sparks is Charlotte and Stacy, and then if we hire any additional people. Because my salary was already budgeted for under health department budget. It would be nice to get that reimbursed, so it doesn't have to come out of county funds. I think, and it's a very appropriate. So I really feel like at least 80% of my salary should be reimbursed. But, just because the health department is pretty good on funding doesn't, So I guess I would like to see that the question about salaries be with those 2 extra positions and the travel. But like Jonah said, if you take away one of those port accounts, that's going to get us down to what we were supposed to have anyway.
Yeah, the only thing I'm saying is, since we don't know the exact wage amounts, I would hate for you to say up to or to this dollar, and us have to track the dollars on that. If you could make that more general or broad, you know, because we don't really know what the true cost of all this payroll stuff is gonna be yet.
So we did a lump, a salary lump of 70,000. That way it's just it's a broad category. Or salary plus benefits at 77.
Well, it does use the same figure, but it's a moving target on the salaries. But utilize the figure that's there. I mean, that doesn't mean that they may be different.
Right,
But
so
I mean,
one
the
may
dollar
fluctuate
amount.
up and one may fluctuate down, and it's still.
Right, I know what you're saying, but the dollar, putting that,
We're getting it complicated.
yeah, it's just gonna, it's already gonna be very complicated tracking everything, and I can't really give you a recommendation at this moment of the way that I'd like to see that stated, but.
You know, what if you just approved the whole 135? I mean, we already did that once, but.
I would like to see you address the salaries completely separate. Like, do all of the other requests as you wish to approve, and then we can come back to the salaries once we have
How about-
confirmation that that what's being presented here is in fact okay, and then you'll have that as a separate piece, because there may be other departments, and then you could take some sort of an action. I'm not quite sure. But, I mean, my hesitation is just, I hate to tie us to this number, and then for some reason us not be at that number, you know, if something's different. And I don't know how to explain it very well. You could say apply the reimbursements as outlined, up to.
Yeah, like a not to exceed number.
It still limits you.
But it's still gonna be flexible, because if she doesn't spend it all, then we need to try to adjust the plan to where it can be spent somewhere else where it is needed, as she said earlier. So.
Or is the best thing to see some of the other Sparks requests before we approve any of them?
You can't wait.
Well, they all should be rolling in now, that's what I'm saying. Just get them all and then.
We have a good portion of them today. I know that there are some that were, well, like for instance, judicial, they had sent you that email about that need. That was not included in our initial plan, so that would take an amendment or an approval from you all, if you want to pay it out of there, which is a completely appropriate expense to pay that way. There was a few others that have come in after that were not included in the initial reimbursement the first time around, so. But those may not be for you right here today, but we'll have them by next week for sure, so. I don't know, if you want to approve it the way it is, and then we can make amendments to it later, that's fine. It's just, the only thing that I have any concern about a hard, fast dollar approval is because we know that payroll amount will change. And that's the only reason. Trying to say, here's your number when you're processing a payroll is not really logistically a very easy thing to do. So.
Discussion.
I say keep the salaries separate too, without,
Keep the
that's what I say,
salary
keep the
benefits.
salaries separate, that way we don't have to create any more cluster than we already have. If we
Keep
can
it a separate
simplify it,
approval, yeah.
then just keep them separate, it's simple to do.
Okay, so we'll come back to the salaries and the benefits and the travel later.
I think that would be the wisest.
So then what about the vaccine coolers?
I think that's part of a purchase, so I think that's part of the,
Yes.
yeah. And then are we still, what about the porta counts, you're still gonna stick with 2 on that, right?
I think you're probably gonna have enough money to be able to do all 3 if you want to do all 3. By the end, because I don't believe that all the cities will probably spend all the money that, you know.
Okay. I don't know,
But
just trying
it's
to keep
just-
it in the budget that the Spark team gave us, and I'm trying to keep it in that. So if we turn around.
I'm fine with 2.
And then we turn around and do salary, benefits, and travel, at least we stayed on target.
Yeah.
Deidre, where would you put a 3rd one if you had a 3rd one?
Well, if we had 3, we would have 1 at the health department and then 1 at each, either EMS or hospital, whoever, you know, wants to be the store or the keeper. But 2 is great. 2 would be super, because then if it was Marion Hospital or EMS, we could just jump over and get it, and that would be great. So I'm fine with 2. Now, if we did 3, we could potentially, I'm not really sure how the fire departments, if they have 1 group for all the fire departments, because they could potentially have the 3rd one.
Jonah, you're concerned about the cost, right?
I'm just trying to stay within, you know, they give us an outline.
Well, she said 2's fine, so
Yeah.
why don't we just go with 2?
Yeah.
Okay, so they, based on the amount presented, they're 19,820 each. If I did the math right, so that would be 39,640 for 2.
39,640.
So we would just take on that 60,000 part, you would take off the 19,820 from that total. So that's 40,655, I believe.
655.
They are, let's see. Yeah, they are about, if we get like the warranty and such, they're about 19,800 a piece.
It's gonna be expensive to keep them up too.
Yeah.
That included the warranty, but I don't know how long the warranty is.
Yeah.
Yeah, and that is providing, you know, the quote is still the same. It was given in June, but I think if we get 2 of them, they will probably honor that.
So Tony, you want to disapprove the PPPE and on down, and leave the travel benefits and salary separate?
I think that's the kind of the direction, the consensus in the room that we are. I was just trying to get the number.
What's the grand total for that?
So Sparks request for the health department, $46,366 for PPE, fit testing equipment, with only 2 porta counts, and portable vaccine cooler, including the data loggers.
That motion?
Somebody so moves it.
Well,
Also move it.
Okay. Motion by David.
I'll second.
Second by Ken. Any other discussion? All those in favor? Aye.
Aye.
5-0.
Okay. And we will bring that payroll information back to you later,
Okay.
once we have a better feel for what that needs to look like, okay? Because we should be getting reimbursement if we can.
Yeah.
Definitely, but we just, that piece is just not a known exact amount, so it's hard to get specific approval. Okay.
Limit the headaches here.
Yeah.
Thank you.
Okay, thank you.
All right, thank you, Deidre. Sorry. Huh. And we got another one.
Yeah.
All right, so I believe next on the agenda, I'm not looking at it right now, is Randy. Frank?
Good morning.
County Departments, I guess, whoever's, Randy. I believe.
Okay, I'm just trying to open all these up and get them minimized.
Good morning. Can you hear me?
Yes.
Slightly muffled.
I'll move a little closer.
Okay.
Better, yep.
And I promise you, there's not a payroll question today.
Oh, good.
Which thing are you starting with, Randy?
If we start with the one that's called Project List.
Project list. Project number 1.
Yeah, it says.
Yes.
Yes.
Right. And to go back to some clarification on a question during Deidre's, there was a question about some PPE and storage. That was actually 2 of my projects together that came to the $900,000. Or, excuse me, no, not the 900,000, but those are the 2 projects that came together about 99 something. I can't remember the number in front of me right now. But you had it up on your spreadsheet earlier, Tina. That was 2 of my projects. One of them was the actual PPE that we've been purchasing for the last several weeks, and the other was the storage facility for it. And in front of you on the project 1 is the storage facility that we'll use. We're looking to put on here that we'll use. It's a 24 by 30, 11 storage facility that will hold PPE and responsible materials we'd like to put it behind the sheriff's department along with the other small buildings he has back there. Currently, the cost of it's kind of like an erector set. You get all the pieces and build it yourself. So the building cost is $8,682. Then for the masonaries to come in and lay concrete is $8,250. The erection of the building is the other $8,714. Once the building is erected and put into place, we will buy 16 6-foot sections of shelving. There are four shelving sections that will be lining throughout the building for the equipment to be setting on. And the sheriff also asked for 2 laptops and software to help out. So that's a total of $33,473.
What about power to the building? Lights?
Say again? Lights are not required.
What do you say? Okay.
I think Sheriff Kraft said
No
something.
climate control either?
No, the equipment we're putting in there won't need climate control that I have. I'm not sure about Sheriff Kraft's equipment.
No, it won't.
Okay. What's our line item?
building a building, you need lights in it.
Always.
You wish that down the road, 5 years from now, it's cheaper now.
We can add electricity to it, we just didn't at this time because the purpose we had in mind didn't require it at this time. But yeah, that would be a bonus, but wouldn't be necessary at this time. But it might be handy in the future.
This metal or wood building?
Be a post frame.
Metal.
Right? It's not post frame. Post frame wood structure with metal on the outside.
No, I believe it's all metal from down Peabody GMLS.
Guess we don't have that in front of us.
What are you looking for?
Metal building, just basically we got the project 2 in front of us, but nothing from project 1.
Yeah. There's not a lot of options there. We want to make up the world our long time.
Got somebody talking. Somebody in the background.
Randy, who are you talking to? Rob or Randy?
Rob's got somebody in the background talking.
Is Randy?
Nobody in here.
Oh,
I'm in a closed room.
well, it might be on the radio or something.
Either for Rob or Randy, you know, it says it's to hold PPE and response materials. What is response materials?
We've got other PPE and air tanks and things that we would put in there with it to free up some more room. Storage room here is at a premium with everything that's been brought in over the last 6 months. And we're scrambling to find places so we can free it up with some of our law enforcement PPE and some meth lab stuff that I would put in there with the PPE.
None of that requires any kind of air conditioning or heating or anything like that?
No, it does not.
Do you have a proposal on the building? Cost.
I believe Randy does.
That would, Tina, it'd be up there, let's see, that'd be the ones, it's, trying to find the one it is here. We should have one there for the building.
I don't see anything.
Yeah, let's see what I can find here. But we did get a quote from the company down in Peabody.
Somebody in Rex building.
That's those metal buildings right on the east side of town.
Outside.
Yeah, just on the east side,
To the
first mile out east of
Yeah.
town.
So this is a 2-car garage. This is
Well, depends on the front they put on it.
Right, but it is 24 by 30, yeah. It's deep, 2-car.
Yeah, it's a deep 2-car garage.
I'll call it.
This building had one overhead door and one walk-in door.
Is it modeled after the big building that's up there? Rob? Is it modeled after that big building there?
It's similar to the one we've got, only it doesn't come in painted anymore. It has to, they don't offer that in a painted surface. But it would just have the one overhead door, which would allow us to get larger access areas and then one walk-in door with it.
Building permit?
Yeah, we need to make sure that that happens with the city and that we have approval before they can, I mean, not before you approve a purchase, but before they can build.
Start construction.
Yeah.
Yeah, we have to have a building permit from the city.
I don't know. Like I said, I almost wonder if we need to be getting all these things in from everybody and then going back through them once we have them all.
What's our time constraint here?
Oh, and it's gotta move pretty quick, but I'm just thinking, there's gonna be enough, the person at the end of the line is gonna get the short end of the stick.
Well, that's a concern, yeah.
The neat thing about this building that they're talking about is you can look at some 30 and 40 years old and they're still sitting there. That's the neat thing. No maintenance or nothing like that. So.
Is it,
That would be our intent, easy maintenance and long lasting.
Correct.
is it big enough? Do you need to make it bigger for future? You never built it big enough when you built it first time.
True, we could use a lot bigger building, but if I limit it to what the COVID stuff is, I don't know. If I'm gonna incorporate a lot of other stuff in there, absolutely, we could use a lot bigger building. But, I mean, we've got a large area over at Hillsborough in the storage area that we could bring some of our stuff home with. If that falls into the Sparks proper use, absolutely, I could. Strictly staying with what I could put in there relative to COVID, this was kind of where it was at. But if we could do a bigger building, I would absolutely love it here, bring some of the stuff we've got strung out different locations home. And still provide adequate storage for what we're getting and what the emergency manager is getting as far as PPE for law enforcement throughout the county and others too. I mean, it wouldn't be strictly necessarily, but that would be the primary purpose.
I would have one other concern about the placement of the building, Rob, is I don't want to break that whole lot up over there that we've already got open unless the commission wants to. I don't know where you're going to put the building exactly, but if you're planning
the intent was just to go on the south side of the smaller building that we've got,
okay.
Which would still not interfere with that pad that was at one time posed.
Okay. Okay.
Yeah. Yes, I'd like to see the proposal on the building. Just
We have to get one.
yeah, I don't know. It's a steel
Yeah,
frame
building,
or is it
80 by 92
steel, or is it?
No. Structural steel. Structural steel building, 80 by 90.
You were saying you want to see the proposal on this building or the proposal on the other building? I'm sorry, I was
No,
confused.
proposal.
I think you're talking about
proposal
two different
on
things.
This, where these values came from.
Okay.
But I still feel like I'd like to see all the requests before we take any action on any. But that's just me.
Jonah, this particular one does not exceed the amount that was originally allotted for. It's the same amount.
Right. But are we looking at all the aspects? I mean, is there any other departments or any other line items up there that could be a combination and utilizing to basically going at the point, could a bigger building be more reduce it, I
You
guess.
also have to think about how quickly you can build something and have it
Right.
done, but you have to have it done and paid by the end of the year.
It's either
So,
build it or purchase it. I mean, it doesn't mean you have to build it, you could find one and purchase it.
Which this is, that's what this is. This building.
No, this one has to be built.
Yeah, it's prefab, I mean, it
Yeah,
just put
it
it
can go
together
up quick.
basically.
I don't know, I'm just thinking, bigger picture, I guess.
Yeah,
mean,
I have some of the same concerns, I mean, I just don't wanna get to the end and then, like you said, somebody gets shortchanged. But if,
And he is right, it does fit in the value that was put on the spreadsheet, so.
Joanna, the spreadsheet only spent half the money, the other half's still left.
It is. It's not, they should total out at 2.3.
I don't think so.
What's the
And
value?
the school got 800.
well, what was already approved with the outline, which
Yeah.
was that spreadsheet, some of these projects were included in that, and, I mean, so we had a lot of, that money has been basically set aside, but it needs your approval to move forward. I thought that you had accounted for all the funds in that spreadsheet, in the direct aid plan.
Should have, because that's what got sent off to the state to get the approval.
I do know that there are gonna be some changes because.
Right, and we were allowed to shift
Right,
funds or move complete line items.
Right.
Because I remember asking, Lloyd.
Scott.
On whether we were confined or trapped into those line items, and not necessarily.
So the issue with the PPE storage, you're going to either need to rent a building or to build something or buy something to store this stuff. Irregardless.
so, have all the departments turned in their requests? They have all the requests?
There's another one coming right there. I should
I
have,
mean,
should
are
have
we
called
gonna
on
have
him
more
because he's sitting
coming?
here.
There may be a couple of others, but I don't think they're gonna be super large, you know, it'll be able to be flexed into what our overall county bucket
Okay.
was. I believe Travis's request was included when we submitted the plan, because, the departments were asked to submit information or to let the Spark Committee know by July 27th, I think, if they needed things. And then the only ones that I know of that came in after was the judicial districts, the sneeze guards for the jury box, okay, which is about $10,000. There were some expenses that I had spent on election, for social distancing signs and, stylus pens that I purchased within the amount of time that they should have been turned in for reimbursement, but I noticed they're not on what was submitted for reimbursement. So those I will ask for you to approve to be paid from this, reimbursed from the Spark money.
So
There's
what-
one.
Go ahead.
Sorry, there's one project, that has come up after this went in, which was, the issue of trying to set up, virtual meetings for planning and zoning, because it's really tricky to try to do that from this room, but also we don't have any portable equipment, so there was a thought of potentially, trying to do something, technologically, where we could beef up the lake hall or someplace we already have to where we could hold a virtual meeting from there. That was not included, but is something that's come up since that maybe should be considered, and I don't know costs on those. So there's not a whole, most of what the county departments are submitting is just for basic, like cleaning supplies, some PPE, those kind of things, and they're smaller amounts. And then we set aside some funds for salaries in the county's portions. So there were separate departments like health, emergency management that had their own whole big section of projects like you'll see here.
Right.
And the rest of the county departments have a few smaller things that are gonna,
But there's enough flexibility in there if one department is requesting $10,000 to take care of something, and another one has an overage, and
by the
there's some
time we
flexibility.
by the time we
move.
get to the end of this, I would think there would be, because we're also allocating, certain amounts for each city, and it's, some of those cities are not likely to
Yeah, I just,
be
you know,
using their funds, so.
That would ease my concern if I knew that there was flexibility between the departments to be able to move some funds around. And what you're saying?
There is some.
Some.
Do you want him just to go through the
Yeah.
different projects before he's,
I would, I don't know if everybody else, I'm not going to, I mean, if somebody else thinks it's,
Well, you know, some of this stuff is just foreign to us sitting here on this. I mean, just like on this project number 1, 2 laptops for COVID communications. Why is a COVID communication any different than any other type of EMS communication or sheriff communication?
Work off site maybe?
I don't know what that means.
Matthew.
Are you on there, Randy or Rob, or?
Yeah, I'm here.
Yes, sir, we're on the, those were 2 items that the sheriff was requesting, so he can communicate in the event that some of his people got stuck at home, and he'd be able to communicate, much like planning and zoning is doing and other things like that.
Okay.
With the part of that also is with the training we're doing, instead of sending officers to meet their mandatory requirements for training, we're doing some virtual training, which these guys can be on their home, can be off, can be home, can be getting their 6-8 hours of training there versus going somewhere, because that's just not as feasible as it used to be. So in order to allow them to do that and work from home if the need arose, but primarily for the training that we're not going to be going to, and so they can get their training hours.
Okay, very good.
I think what you're asking is you want to see everybody's project so you can see the total and see where we're at before we, okay, any of them.
I'm gonna go run back through them.
And
Unless it takes more time for everybody.
what do you think? We've got one more here, and you think we've got a couple more coming in?
well, I don't think that you probably have any, nobody else let me know that they were coming in today.
Okay.
There may be a couple other small things that come in. I would say next week would be the last that I would probably
Let's
be
put a deadline
bringing
on it
to
for
you.
next week then. Put a
But,
deadline on it.
but that doesn't, you're not gonna be able to wait on those next week requests to be able to move forward, because like, you know, the time is of the essence as far as being able to have people move forward on these
Well, some of
things.
these were you already took action on the fair deals and stuff, so.
We did on the PPE, we allowed that before we even got approved by the state.
Yeah.
Right. I will say that the projects that are being presented here, they were, I believe, I wasn't involved with the SPARK committee, but they were already discussed there, were they not?
Yeah.
And,
In general.
yeah, not in specifics, but,
People just submitted what they thought they wanted, needed, I guess.
so.
I guess
anyway.
I'm good with moving on to project 2 and seeing what that is, and then seeing what the other projects we have, and then.
Approving them all later at the end
Yeah.
of this session.
And
Okay.
then,
Let's do it, let's get going.
okay, we'll go on to project 2, Randy?
Yeah.
Yes, sir. This project is an emergency response trailer that will be used by different functions throughout the county. emergency management, law enforcement, public health will all put this to use. There's a list of equipment that goes inside of it. Radios will be installed in it that will be able to use computers, monitors, and such that will use a variety of different events. For example, when large facilities require COVID testing, or as Deidre mentioned earlier in her presentation, when she does the large flu vaccines clinics at different locations, we could definitely use it there. When law enforcement does the variety of responses, for example, this year they worked with ATF on an event, on a manhunt looking for some individuals just south of town here for quite a while. We could have used it for that. Or other search and rescues. Just recently they had a boater stranded out on the lake as well. Large wildland fires. We've been very fortunate this year, knock on wood. We haven't anything large, but in the last few years we've had several 100-acre plus fires that have gone on that could have definitely gone in the wrong direction. We would use them for other disaster responses, such as flooding. Last year we endured that, and we're still trying to clean that one up, and other things that go with that. When the trailer was not in use for a disaster or an emergency response, Public Health and I have sat down and visited about this. We would use it for disaster preparedness and public health emergency services education days. Since there are 12 communities within our county, we could set up a couple of days out of the month to actually move the trailer into position and teach classes or have conversations about creating home plans, getting your emergency plans within, your communications plans within your families, things like that. We'll discuss those things to do that. And public health would do the same thing at these type of events within the different communities here in the county. This trailer can provide a lot of resources for a lot of emergency services to include public health, and the county would definitely be in a good position to have a tool that can help us with these different activities.
Randy, does that not have to stay COVID related? I mean, can we actually branch off to just other emergencies, or do we have to stick with COVID related here?
No, this one's already been pre-approved through the state, and it's related to the public health side and the emergency response, as it was in Tina's spreadsheet earlier. We're in one of the categories will tell you it's a public health.
Okay, so that's separate then from the COVID, or just in addition to it?
No, it's the same as the COVID, the public health piece of it. It's a category that somebody in the state or the federal level came up with.
Okay.
But it fits into that category.
I think that, are you kind of asking how this purchase is COVID related specifically?
Yeah,
Okay.
that's what I was asking, because I don't see that. But
So what about this trailer, Randy? I think is what she's asking. How do you relate this to COVID? Why do we need to relate on COVID?
Sure. Relates this to massive COVID testing. Tabor College and all the schools have asked us if they run into an issue, especially with all their athletes, so where we can do major testing for those kind of events. And so that's how we would use that for the COVID piece.
But that's a projection if. What if we get the vaccine for the COVID and we don't need it? I mean, I'm just asking. It's a what if.
If we get the vaccine and don't need it, I'm honestly not sure. I'm not a medical professional, I can't tell you.
I mean, I'm just wondering, because I'm hearing a lot about a proposed vaccine not too long away. I'm just wondering. If it was a for sure thing, I would be a little bit more, but I'm just wondering because it's a what if. Although I'm sure it would be nice then for all the other things that you're mentioning, but I'm just kind of afraid of rearing off. Grants, as you know, Randy, are real particular. And I'm just kind of worried about rearing off a little bit and getting bit in the end.
One thing that I have heard discussed, and I have not been like at all these meetings, but that one of the proposed uses of the trailer would be to go to different sites to do mobile testing potentially, or to go to mobile sites to do vaccine clinics when a vaccine is available. So that is how it would directly relate to COVID. It gives you outdoor space for the individuals coming up to where you have more of a safe space, so to speak, than bringing somebody inside. So that's the way it was presented that I have heard. So that's, I don't know if that's accurate, but that's.
Okay.
Okay. Well, thank you, that makes sense.
So you went with the, on this one, you have proposals here, so you went with the MO Great Dane?
Yes, that's the lowest proposal out of the three.
Right.
There were three of them. One was out of, let's see, Cresco, Iowa with Featherlight. The JHB Group was out of Illinois, and Mo Great Dane is out of O'Fallon, Missouri.
Okay.
And they gave us the best price out of the three.
Are they all apples for apples? I see that one of them has, health incident package. I mean, just, are they all equipped exactly the same? Because there's quite the price differential.
No, there's some of them threw other things in there that we would never use. But even with that, you go and you look at the items that we would use, the Great Dane Group was still the lowest price for the items we would put to use. One of the items, I think that Deidre mentioned earlier too. She mentioned something about a refrigerator, I think it was. A quote for a refrigerator as well to put in the trailer. And if it's the same refrigerator, if it's the same portable refrigerator that you've already allowed her to purchase, then we won't purchase one, obviously.
Oh, they were not even comparable in the price difference.
It sounds like what hers are like portable coolers, is what it sounded
Okay,
like.
all right, okay. That's the one she recommended that we put into the trailer so she could use it.
We're already getting doubled up on the first two.
I think Deidre's was portable ice chest.
Yeah, hers are like.
That's what I thought.
She would still need something,
This one's big.
in the trailer, according to what she said to me, so.
And this one's designed to be portable as well because it'll stay in the public health office to stay at the certain temperature that she needs it at, and then we just roll it into the trailer and plug it in.
There's room to store this too? Keep it out of the weather?
So it'll be stored at the public health office because it has to continue to be plugged in to stay at the right temperature.
Yeah, I think he's talking about the
Or-
trailer, not the refrigerator.
Yes, the trailer, yes. We can put it in the storage area that we're in right now. It'll fit in there.
Yeah.
So,
Like everybody
Just
to
gonna be able to
remember,
hold that.
if co-op decides that we're not of importance and they just sell the building or do something different with it, that they can tell us to take our stuff out of there. That was the agreement that we signed with them. So, keep that in mind.
Randy, on this trip, are you having two walk-in doors so you can do, like you can do vaccine, people go in one and out the other?
Yes, the back of the trailer, like many trailers, the entire back door will fall down.
It's like
It becomes a ramp.
It's
Becomes
like
a
a
ramp.
toy hauler that's been totally
Yeah.
shelved on the side, from what I see.
But it was designed to set up with the awning and set things outside to do drive-ups and things like that. We did a drive-through flu clinic, I think it was last year, I think, or the year before, and that's what she's looking at for her piece.
Is she gonna be able to hold it?
That's only 24, ain't it?
Yeah.
It's not that big.
And this item too stayed within the proposed budget that was approved a few weeks ago. Maybe it's been a month now.
So are you gonna add more equipment to this? Cause in Sparks, you had, $90,000 allotted.
There's 98
Yes.
here at the bottom.
98, yeah, so.
It's out here at the bottom.
Yes.
Dave.
The additional equipment up at the top there is the filing cabinets, the tables, the monitors, computers, We'll put an internet hub in there, of course, so we can use it.
I mean, we got $40,000, we could build a shed for it.
Well, that's just it.
In town.
Is there a need for a mobile, when we have all these different communities? You know, I don't know, I'm just thinking.
If what you're asking is what Tina has up there, these are two different line items. The storage shed and the trailer are separate. The storage shed and PPE are together, and the trailer's a separate item.
Is that on the $99,000 line for the shed and the PPE, or we have two lines for PPE, and so I'm not sure what that is.
Those two are my projects. The 99, 912, 48. That's the storage shed and the PPE together. And then the trailer is down, let's see, down here a little further.
That's
there you
the
go.
98, yeah.
98, 190, 20.
So the 141.
I believe that 141, well, that's for county farm. No, I'm not sure where that one goes to. But I believe some of that was for the Sparks, excuse me, not the Sparks, but for the testing materials they was using. Some of that was in there as well.
Okay.
What's it say underneath?
Hey,
the arrow?
this is Anthony. Hey, yeah, that 141. I'm not sure why it's listed like that, but that should be for the Tabor testing lab.
Okay.
Now that does include about 1,000 tests for the county to use for testing at that lab.
And that's what Deidre was saying earlier.
Okay.
She said there was kits.
So the rest of the county department needs are kind of in this $99,000 chunk here. So.
Does Tabor have the same amount of cameras?
What?
Does Tabor have that amount of cameras? Just wondering, okay. I'm curious who maintains all that.
Okay. So those are the only projects that you have, right, Randy, that are being
That's correct.
presented, or did you have others?
No, that just those two.
What's the timeline on getting a completed trailer?
As soon as possible. They know we're meeting today. So, it takes right now, they say, to build one of the trailers is about 10 weeks. They have one online right now that should be coming out on the 1st of October. In projecting this, if we were possible to approve this, we would be looking at one of those coming out here at 1st of October.
What are we gonna pull it with? I mean, that takes a 3/4 1-ton truck to pull it. Emergency management just has a 1/2 ton, right?
That's a 3/4 ton, actually. And we also have a 1-ton dually.
All right. Look at the next request.
I think so.
Yeah, you sat here long enough. Thank you. Are any of the other departments on? I'll get to you after Travis, but if you've got anything to present, it'd be nice to have it. So, with that, I'm gonna go ahead and go back to Travis.
Yeah, when this started, I believe Tina, we kind of earmarked around $40,000 for ventilators. Obviously when COVID started, ventilators were a big thing, and they kind of tapered away from that. However, with that being said, we would have the opportunity to have the only portable vents in the county. At a price, two vents and supplies at a price of $34,093.04. They would also be utilized on a fairly regular basis. When we have somebody intubated, we need to run down to Wichita instead of sending extra people to assist with bagging the patient on the way down. The ventilator would do that for us. It would save us on oxygen supplies, and it would also, we're using CPAP. It gives us CPAP opportunity at a cheaper price, as well as BiPAP. So I think it would do good business for EMS to have ventilators, and ties right into COVID.
How big are they?
They're small. They're little portable guys. Yep.
Okay. You guys got enough stuff on your trucks, but.
Yeah, it's another thing. It makes a mess when we have a critical patient. 349304. I can make a copy of this for you, John. I just haven't got it done. So
34, oh, 93, 340.
Yep.
Was a little light there.
Is that 2 of them?
That's 2 of them, and there are some disposable parts that come. I mean, there's 10 different masks for CPAP. We would have 10 in different sizes, and then obviously as we use a vent with disposable parts that we would maintain as well. So
now, which line item does this come off?
This is part of the 99,659.20 that was set aside for county needs. It just says cleaning and disinfectants on here, but that's not, I'm fairly certain that the 99,659 was the county department needs.
That include, those things, do they have like a ongoing maintenance?
That's includes annual preventative maintenance, support, software updates.
It's all in that price?
Yep. Battery replacement, 4-year, it's a 4-year preventative maintenance agreement, sole, that's who our monitors are with. That's all of my project, I guess. Unless we throw some building and salary on it. No?
I don't know.
Okay.
I don't think we're gonna jump on the salary cliff today.
No, and you can't have a building either.
Okay,
sorry.
well, I went with the wind, right? Sure, this will be a win. So.
Sounds good to me.
All right. Thank you.
All right, thank you.
Thanks.
Yep.
There. I don't know that anybody. No comments made on the bubble, or no anybody has anything, other department heads.
The one thing I did include in, when I provided something to Janine when we first, which is part of that 99,000, and that was to extend the viewing area for the commission meetings into the hallway, like what we have been doing with that monitor we borrowed from Dave, but it would be like a permanent wall mount that would go on the wall, that main blank wall there. So we could share, we can actually have the ability to transmit directly to that, which should cut down a little bit on the noise. And then also we can share COVID-related updates. If we wanted to have like public information on one side, when we're having a meeting, it could be the full screen. Just in talking to Lloyd, that project is, it'll be under $3,000, and it would be like the TV portion, maybe between $500 and $600. It would take a computer, which would be under $1,000. So overall, the parts and pieces of that are not over $1,000, but I did include that initially in a request when that first one went in July. So I don't have any information on that just yet as far as total cost, but I did ask, and it was going to be relatively small.
Well, some of our costs, the sneeze guards that you built for all the offices, was that in there too?
Yeah, everything that we've already spent,
Okay.
and then all of the
That went all over the already.
Yes, that already went to the reimbursement portion. It's
Okay.
just projects that haven't been done yet.
Okay.
So that is one that I did ask to be included, it was included, but, the parts and pieces of that are small enough. I didn't do a presentation, but I just want you to know that was in there, so.
It's pretty neat to walk upstairs to the court system and see what they're doing up there. You can see the cases that they're handling that day and stuff, and it's just a TV, just.
Yeah,
just
ours would be similar to that,
Yeah.
and that's something that I had talked to you all
Yeah.
about before, so.
I think it'd be good.
So, I don't have prices, but I'm sure it'll be under $3,000 for that, so.
One thing we didn't ask Randy was how much already been spent for PPE. Because that ties into that 99,000 that the building comes out of.
Right, but you approved that
Right.
portion, so
Right.
I would just say approve, the approval would just need to be on the portion that hasn't been approved already. So, which would be,
We don't know what he spent though, out of that allocated line item.
I know, but he's only asking for $33,473 for project one. So that's the approval that we still need, if you're gonna go ahead with that. And then the project two, that 98,190 is what's needed.
Right, but if he's already spent 66,000, that puts him right on the line. If he'd spent 72,000, then that line item is over. If he's already spent that on PPE. That's what I was getting at. Surely he hasn't spent $66,000 on PPE already.
I don't have that in front of me. Randy, do you know how much you've spent so far on PPE?
He left.
No, he's still there. His mic
Okay,
came back
I'm
on.
back. Sorry, I had to leave the room. We've spent $38,100.25 on PPE.
38,000. So they're still running in that line item. We don't have any other information to go on, so
We don't have an emergency response trailer at this time, do we? We do?
It's an old one.
It's an old one?
It's been around at least 10, 12 years or more. I don't know.
Is it small? Or?
It is small, yes, but it's small.
So it really wouldn't accommodate what we have?
It's the red, isn't that
Yes,
the sheriff?
The red
though?
one, yeah.
Isn't that the sheriff's?
Dispatch
Okay.
trailer set up, that does the same thing what they're asking for here.
It does the same thing?
Well,
But it's small, you're
it's
saying?
small, yes, it's small, but it's got room for dispatchers in there, and you get 3, 4 people in
Well,
there.
not really.
Okay, what was that, Rob?
That other trailer is primarily set up as a mobile command center with a dispatch. The front portion of that is strictly set up for dispatch with radios mounted in the back along one wall, a whiteboard for a command for a critical incident. There's not the room or the ability to do, I don't know what all Deidre and Randy have for that one, but it's limited in its room to work out of for to provide medical care.
So it wouldn't be
Since
suitable.
the whole
for-
front end is set up for radios.
Okay, so you're saying it wouldn't be suitable for what they're asking for, basically? Is that what you're saying, Rob?
I would, that it doesn't suit that need. It wouldn't be good in that role.
Okay, all right. Thank you.
There is some elements that are duplicated, right? Like the radios, the ability for
Yeah, I don't know.
one to take the place of the other. This one could take the place of that one, but it couldn't go the other way. Is that the way I'm hearing it?
So could we keep
the-
the other one then?
No, because I don't know what kind of communication the other one is set up to do. I don't think it's set up to do near the communication that the red trailer does, that the dispatch has. It's primarily a mobile communications trailer and set up as such. Use it for command post on critical incidents. To utilize it as a medical like they are discussing, I see a lot of shortcomings there.
Okay.
Okay, thank you.
You get 3 or 4 people in there and it's crowded.
Oh, okay, thank you.
You're welcome.
There will be some duplication when it comes to electronics.
There's, but like I said, one's probably the elite, and this one is.
I can't hardly hear you, Jonah.
Oh, I was just saying, the red one that they already have is probably got the elite mobile command communications in it. This one has just got, it does have some command in it. I mean, it does have some radios, internet hub. It's got some things, but it's not really everything the sheriff probably needs.
Okay.
The way I'm looking at it, I'm not trying to.
Well, I like the way Rob answered the question. He pretty much defined the difference. Okay.
Ready to take some action on some of these?
I'm ready. Let's do something. Let's go.
Well, we still got interviews this afternoon.
I know.
Is there any commission discussion as far as any of these go? Any thoughts?
I would like to add on the building, if I may.
Yeah.
With approaching winter time and trying to get concrete poured, I would like to proceed, if that's your decision, and I hope so, in a timely manner, so that we don't end up in December, January trying to pour concrete and all the issues that creates, and for being able to get it erected while we still have some decent weather ahead of us.
They always pour concrete in December. Never fails.
Yeah. I
don't want to do it.
Yeah. Yeah.
Well, I don't have any problems with it. I'm saying just move on, and if we're gonna approve it or whatever, I don't see why we should delay. Just.
Do you have 4 stakes out there where it's gonna go, Rob?
I have not. We measured it with the tape to see.
Okay.
No, I did not stake it.
Okay.
On the dirt.
Well,
No, this is south of the white one. You've got some existing buildings, and that's what he's talking about, just south of them. I'll see if I can swing over and make sure where you're going, Rob.
Okay. I'll show you where it's at.
Okay. If you can walk.
I'll get there.
Okay.
Not running, but
Okay.
I can get around.
Good. Well, I think there's different things here. Some commission is gonna have to decide if they want a big building over here to store things. And this is a little building. I think it would still be usable even if the big building happens. So that's just as far as the buildings I can see. And I know that if you look over there, I think, like Rob said, he's got one of the little ones already, but I have one of them personally, and that's 15 by 30, and I've had it for many years, and there's just no maintenance to them. I think that's the big thing about why he chose this on this building. So, but yes, you will have to put it together and stuff. But that crew comes out and does that. The way you've got a price there.
Are they insulated in?
Yes.
No, they're not insulated. Strictly just metal. No, there is no post in them or anything there. Metal support. I mean, that arch supports itself.
Oh, it's a Quonset style?
Yeah.
Oh, okay.
Yeah.
That makes sense.
Yeah.
All right.
You never go to Peabody, do you?
Well, not anymore.
Yeah.
I used to, quite a bit.
It's on the west side of town.
Okay, so are we ready to make a motion or something?
Need a motion to start with project 1, or where do you want to start? Okay, I'll make a motion to approve the project number 1 of Marion County Sheriff, total project $33,473.
I'll second.
Guy, second by Diane.
Got it.
All those in favor?
Aye.
Aye.
I think it's not a storage tank.
All right.
Not a camper person.
I'm not doing that.
Next item.
Randy, you still on?
Yes, sir.
Your project number 2, you've got the price of $58,000. That's the trailer, and then your other, all this comes up to, and your radios and everything come to a total that you got down to grand bottom at $98,190.
Yes, sir.
Okay, that's everything that you have listed on the page here.
Yes, sir. And that's the total price. It's highlighted. I don't know if yours is highlighted, but
Yeah. Thank you. That was my question.
Well, I'll go ahead and jump in here. I'll make a motion to approve the Marion County EMS for the 2 items at $34,093.04.
Oh, the
So
ventilators?
you're talking about the portable bins?
Yeah.
Okay.
I second that.
Kent seconds. Any discussion? All those in favor? Aye. Now,
Randy, this is Kent. These Motorola radios, are they the same ones that the very same ones that we're using for fire and everything right now?
yes, same type of radios. It's a newer model because it's been a couple of years since we bought those. It's the same type of radios.
Same operating system and all that.
Yes, they're all 800 megahertz systems.
So do you really need 4 of them in that trailer?
Depending on the size of the event that happens, it creates 4 workstations. And each, depending on which they're called top groups, we used to call them zones, but they're top groups. So for example, one will be on for law, one will be on fire, one will be on EMS, and then there's an emergency management one. So there'll be 4 different ones, but they have to be run separately, the top groups too.
But don't you carry like one in your mobile unit?
Yeah, I have a radio in my truck. Is that what you're asking?
Yeah. I'm
Yes.
just wondering are we duplicating some of this stuff?
What he's talking about, Kent, is he would set up 4.
Right, I
Yeah.
understand what he's
Yeah.
talking about.
And so
Preparing for the worst.
he would leave one on each one of those channels so that if you had groups of people out on the scene, they would come back on that channel and not interrupt with these other 3. I think that's what you've got in mind, I believe. You know.
That's correct.
Is that right, Randy?
Yes, sir. That's correct.
Yeah.
lot of money for radios.
It's a big ticket item, and I just,
Would that, Randy or Rob, both of you, the other red truck does not have portables to switch back and forth between on the 800s anymore?
Yep, the red trailer has the capability, just very similar to dispatch, where, yes, there's a radio dedicated to each channel, because you have to have the radio dedicated to each channel, or you're gonna lose half of the calls incoming, because you're transmitting on a different channel, different frequency, and not going to hear them. Yes, the red trailer does have that in place at this time.
Okay. So there is no unit that, instead of the 17,000, there is no unit that would sit there in there and catch all 4 of these and be on one setup, huh? Like a dispatch?
Not that I'm aware of. I'm not a techno guy.
Okay.
But I don't know of any. We put a combiner in dispatch to limit the number of antennas, but whether that would be able to limit the number of radios, I don't see how, because you have to have a dedicated frequency or radio for each frequency that you expect to be communicating on.
Right. Okay. Thank you.
For scanning, you're going to lose half of what you're trying to catch.
Right.
And calling in. It would be similar in the setup in the red trailer, only less extensive. The red trailer has more capability than I think this would have.
I mean, is this, I guess I gotta ask you, I mean, just, is almost $100,000, is this the best use of this kind of funds? Everything else is rolled out. This is the, really what makes the difference?
I don't know. It just provides a capability and opportunity. And again, this is not my trailer, so I'm probably speaking out of turn.
Yeah, I guess it was everybody, I guess, Randy included. I wasn't just trying to pick on anybody. It's a lot of money for a trailer. I mean, I just wonder, is it all the other items been thought of that this amount of money can be spent on?
Jonah, one of the challenges we've had during this last 6 months is not being able to use our EOC that we have, because the sheriff had several things in there that he was required to get done, which tied up the building for quite a few things. I had to move into a kitchen to create an EOC, and this would also function as an EOC as well.
And what he's talking about, the EOC is in health department. The certain area was cleared out, and computer screens, monitors were plastered all the way around. So.
I mean, one way to look at it, it's going to be free to the county. We don't have to buy one in the future with the tax dollars. It's a grant. I don't believe in grants, but
right.
It's kind of a catch-22.
Yeah. Usually, if you don't take it, you get behind.
If we don't do this, somebody else will, and we'll miss out on it.
I don't know, emergency management building, or something else that could have all these things
You
incorporated.
can't use that money for a building.
Well, I mean, it's just. I know we had tasked the task force with it, and I just $100,000.
But $100,000 in retro, when you're thinking about 2.3 million,
right,
is what we got. I think emergency management is as equally as important as any other department.
Well, I'm grateful for having them through this.
And I mean, like Dave said, it is an opportunity to increase our effectiveness in emergency situations, and especially what we may be faced with going forward. So That's just my thought right there.
This might allow us to save money for four-wheel drive ambulance, which, that's what we need with our
Say that again now?
four-wheel drive
Yeah.
EMS vehicle. That's what we need to buy next, really.
I think what Dave is saying is that not having to spend these monies for this capability out of tax dollars might allow you to reallocate some of your tax dollars for the future to buy some ambulances with four-wheel drive capabilities. Is that what you said?
Yes.
Okay.
Right.
She's an excellent interpreter, isn't she?
So,
She knows how to
by,
think
Yeah.
by
about it.
using this money would save us money somewhere else in order to buy the ambulances? Is that-
Yeah.
Well, what he's saying
We
is
can use
instead of
money.
using tax dollars here, you're getting this money for free, basically.
Right, right.
So if you would have had to buy this outright,
If we'd had to buy this outright, we wouldn't have, in other words.
Right, but we just had to buy this outright.
We just want this thing to be, to me, I don't want it to become a white elephant. I want it out there, people need to know it's there, it's gonna be used. Because I get calls from people and say, why is this trailer sitting here for 6 months, or why is this truck sitting here for 6 months?
It sounds like Deidre.
And, I mean, I think you've got a plan for it, but it's gonna take a lot of, planning with the agencies around the county, you know, so we can effectively use the thing.
Yeah,
Well,
to
I look at-
implement it.
I guess I'm thinking, not just the emergency management building, but we got troubles with radios. I mean, is this money not better spent trying to improve our radio system, make it better, put another antenna up?
Can we do that?
I don't know.
Is that
I mean, I
COVID
just,
related? I don't know,
COVID?
that's the problem.
well, it's an emergency management, you know?
Yeah.
yeah, but this is specific, it has to be tied specifically to COVID. This money does.
Yeah.
We've already had the problem prior to
Well,
COVID.
yeah. I just, you know, really wanna make sure it's.
You know,
spent
just a
right
real
place.
narrow thing that you can spend the money.
Yeah.
No, it'd be nice to take it off and do something else.
No, I'm not trying to do anything. I just wanna make sure we're doing the most we can with the dollars.
Yeah, this money would make a real nice slab.
We just
for a
want the
new-
best
new
bang for
big
the
building.
buck, is what we want.
And so I know some of the concerns that we have with people when they say, well, is that trailer just sitting there, or that truck's just sitting there? But the truck that they're referring to really isn't ours anyway, it's Homeland Security. So a lot of times people are just
Right.
seeing stuff sitting there and assuming
Right.
that we're not utilizing it because they don't have all their facts, so.
But see,
Especially when
this-
it comes to emergency planning.
This one will be ours.
That's right.
This one we will have to answer.
That's right, that's right. Mhm. And now that if we get one, if we approve it and so on and so forth, then we need to start making sure it's used.
And that's what Kent was going back to.
Yeah, and it sounds like.
Right,
Deidre-
it's gonna take all the agencies around the county to buy into this, not just EMS, not just emergency management, not just sheriff, but all of the fire departments, you know, the health department, you know, as far as the clinics and that kind of outreach clinics and.
They would give flu shots.
If we do get to immunizations, that this thing is in every community in the county.
Not at one time.
It's 24 feet long, we can divide it out.
Yeah.
Yeah.
Yeah,
No, I mean-
I'm like you, I hate to buy this white elephant, but we got a chance to get something that we could use and turn into something. Like Kent says, you know, if it's, do flu shots, COVID shots, just.
And I have no doubt that it will get used for flu season. There's more than just flu season too, you know. I mean,
Yeah.
it's gotta be, like Kent said, it's gotta be a collective. I mean, it's gotta really.
And I hope we don't need it for emergencies.
Otherwise, it's gonna be sitting a lot. Anyway,
All right.
neither here or there, we need to move on it.
Well, I'm ready to make a motion to accept project number 2 for $98,190.20.
Got a motion on the table?
I'll second it.
Got a second by Dave?
This is, Great Dane one,
Say what?
Great Dane one.
It's project number 2 as presented in front of us with a project total cost of $98,190. So it would include the Great Dane trailer and the listed components within the project number 2.
Because Randy said we had it the first of the month. Yeah.
So, got a motion and a second. Any other discussion? All those in favor?
Aye.
Aye. 5-0.
Okay, real quick question, did you want to go ahead and do an approval for the sneeze guards for the judicial district for the $9,800 approximate cost?
That also comes out of that 99.
Yes.
I would so move.
Moved by Dave,
Second.
second by Diane. Any other discussion? All those in favor?
Aye.
Aye. Now, what about the monitor? Or do we want to wait till you get us a firmer?
You can if you want to, or you could do it as a project not to exceed amount, if that's something that you want to implement before the end of the year and to utilize to help with the extending our viewing area.
Not to exceed on the viewing board out here, not to exceed 3,500.
Second. Motion by Randy, second by Ken. That also comes out of the 99,000.
Yes.
Any other discussion? All right. All those in favor?
Aye.
Aye.
Okay. One other thing on the Spark monies, there are grants that are we're gonna be sending information out now, and these are for nonprofits and small businesses. And there's an application that is just being finalized, and I just want, and there'll be a flyer also, and it'll be on our website, but commissioners are gonna have to help spread the word on that, what that funding is available. Because again, it's a small time frame for them to apply and provide their receipts and et cetera to be able to be awarded
Is
for
there gonna
this.
be a maximum or minimum on those grants, do you know?
They did not specify what that is, so it kind of, there'll be a lot of work of the Spark Committee to review those and kind of rank them. And they set a deadline of October 1 or 2, I don't remember.
October 1st.
But the application's not available yet?
It will be today, I think. So
Yeah, I've
as
seen
soon
it.
as we have it, and finalized, and I know that it's the final, I'll send it to all of you, but there'll be a flyer, and then we're gonna be putting some ads in the paper, and also press release will be coming to the paper, so hopefully they'll run that as a news story.
Tina, I just sent out the final PDFs to the task force, so we are ready to roll it out.
Yeah.
Okay.
Did you send it to me today?
Yeah. Yeah, and then.
Yes, I did, Dave.
Westy's already replied back to you. I've been watching stringing across the bottom of my screen like stock tickers.
Okay, so I can send that all out to you by the end of today, and then, but if you can help spread the word on that as we go along, that'd be great.
That doesn't include farmers again. I'm guessing.
Everybody get
I don't know that there's a,
So we want
No, I
to,
do.
or we need to do anything else here. I lost my agenda.
well, you had asked, so you have on your agenda, after the Spark project approvals, which you've just done, the next thing you had was public comments and commission comments. You had a performance review, and then remember Nikki had an executive session that she wanted with you. Then you had a lunch break in here, and then you have employment interviews starting at 1.
Yeah, so I'm thinking we ought to take
We'll
a
wait on
recess until 1. It allows everybody to do that, and then we'll go back to the interviews and move our performance review and public comments on after that. Or is that, or we could do the public comments prior to the interview.
Yeah, and then did you want to do your employment review next week? You can move that back a week if you wanted to, for the one you're doing, for the 6-month review, or if you want to do it after.
We got a couple, one that Nikki's requested and one that we were, our 6-month review and.
Weed department, no.
Anybody have any suggestions? Or you wanna just keep on going through?
Just
I'm
do it.
there. Okay,
Get it done.
all right. Good.
Someone had to fight an executive with the board.
Probably.
Came with this one that we need to talk about for just a minute.
Well, sometimes that's best to do now.
Got 30 minutes to do it here.
Yeah. All right.
Litigation.
Okay. So I move that we recess into executive session in order to discuss active litigation
It's the attorney-client privilege.
for item number 2, consultation with our attorney for 10 minutes.
Should be amplified, probably will actually do that.
Okay. So we'll resume the meeting at 12:40? 12:45. The virtual meeting at 12:45. With the board and Brad pursuant to KSA 75-4319.
Jonah, what clock are you going by?
My computer.
Okay.
I should have went with the.
Got 12:31.
Yeah, so it's on the cell phone time, it's 12:31. Did
Yeah.
you want to just go for 10 minutes? Is that
10
what your
minutes.
motion was?
Let's just do 10 minutes.
Okay, so back then, now it's 12:32, so at 12:42?
There we go.
Is that okay? Okay. All right.
I got one with Ken.
Okay.
All those in favor?
Aye.
Aye.
Thank you. Okay, we'll be back in 10 minutes.
This conference will now be recorded.
There it is. Yeah. Out of executive session, no action taken. We want to. I don't know that we have enough time to take care of the performance review.
I don't think so. I think that maybe you either do that after your afternoon session or just postpone that to next Monday. And just also Nikki just now went to lunch. She was kind of waiting around, but she went to lunch, so we can't take care of that right now either. So
Okay.
you may want to take a few minutes to stretch and to like review the information for your afternoon.
Okay. And then, or do we want to take the public comments now, so that way that's wrapped up? Yep. I don't have my screen open, so I don't see anybody.
It looks like we're the only ones on the meeting right now. Nobody else came back.
Well, I guess we better wait till we have at least some people out there before we do public comments, right? All right, let's take a recess.
Okay,
Till.
so
Till.
Recess.
Until 1. Okay.
okay.
This is the gal gave us that.
Okay.
Oh, that's pretty.
This conference will now be recorded.
All right, out of recess, resuming. At this time, I'm gonna go ahead and put forth public comment section, just because I need that to be done, wrapped up before we go into the afternoon part of our session. I'll give it a few minutes.
Yeah.
Yeah. bubble. If you put anything in there and then they join,
They don't see
They
it.
don't see it.
Yeah. That's okay, nobody has joined the meeting.
right?
So.
Go ahead and close the public comments. At this time, I guess we're gonna move on to commission comments. Everybody's pretty well had to say something today.
Somebody may want to make another comment.
All right, and then I'm gonna.
I do, we just don't like our chairman telling us all what to do here now.
Well,
Just wanted to make a decision.
okay, very good. All right, take that constructive criticism and move on. All right, I will close the commission comments too. We'll move on to, we're gonna postpone our commission performance review until next week for the record. And we've skipped our lunch break, and now we're on to our employment interviews that pertain to our administrative position.
Appraiser.
Appraiser.
Yeah, are we?
Yeah, whoops.
Watch you.
Thanks for the clarity.
By the
That's good.
interim appraiser, we're skipping that till next week too.
That will still need to take place today, I think.
Okay.
But she will be back for the portion of this, so.
But we would have to have an executive session for that.
Yeah, we'll have to have an
Okay.
executive session
Okay,
with that.
all right. Gotcha.
So that will still be.
Okay.
So you're gonna like tack that on the end maybe,
I'll put
or?
that on the end, and
Okay.
I don't know, having it not on the agenda, whether we wanna take any action on it anyway. Maybe that'd be an item of action first thing next week? Or is that something we would need to be?
Well, it was on the agenda as part of her talk. I mean, she did have.
She was in the agenda when she asked
She
for
had a
it.
department update.
Yeah.
So, yeah, I guess
We may have to take
we
action.
may have to take action. If we do, we'll take action before we close the meeting.
Okay.
We'll need to notify, make sure that somebody's here.
Well, if the press is interested in any action taken after that last session, they can get with me. We're just saying that at the end of the employment interview portion, you're still gonna bring Nikki back for her requested executive session from earlier. She had
Correct.
requested a performance session to discuss personnel performance. And so if they take any action after that, he was just saying, we just need to make sure that. So here's your, if they decide to take any action, I'll let you know, or you can ask me later. Okay, if you don't come back. Is that what you meant?
Yes.
Okay.
I wanted to make sure that they
Yeah.
got.
So there might be potential action after the interview portion because they haven't gone back to that personnel performance executive session that was requested earlier today.
So if they do take
You are-
action, you will be getting in touch with me.
Yes.
You're a very good
This
translator.
is- Huh?
She is a very good translator.
And the interviews are technically executive, aren't they?
Yes, they are.
So we're done?
Go enjoy the nice weather.
See you next week.
Huh?
Go have lunch, enjoy the nice weather out.
Yeah.
Think about us.
So, when you go into executive session, you just will, the topic is for, is employment interview. You do not have to say the name of the person, and then just the amount of time. So you would say with the applicant and the board present for however much time it is. So, okay? And that's under number 1, which is personal matters of non-elected personnel.
Okay. This time, I move that we recess into executive session in order to discuss employment interview. Item number 1, personal matters of non-elected personnel. For, looking down here at my.
What'd you say, Ken?
30 minutes?
Anybody longer than 30 minutes for an interview?
You can, if you want more time, you can always come back
Yeah, we can
out
come back
and
in. Okay.
extend it
30 minutes
with,
with the applicant.
yeah.
The board, pursuant to KSA 75-4319B. Second by Ken. All those in favor?
Aye.
Aye. 5-0.
Okay.
Nobody was notified. We'll be back on.
This conference will now be recorded.
Is your county's doing this too, recorded?
No.
So, out of executive session, no action taken.
I'll move we recess in executive session in order to discuss employment interview for the appraisers department. Item number 1, personnel matters of non-elected person, is that right?
Yes.
Yes. Personnel matters of non-elected personnel pursuant to KSA 75-431-19B with the commission and applicant for 5 minutes until, let's see, that'd be 1:30. 1:30.
1:40.
1:40, okay.
Second by Randy. All those in favor?
Aye.
Aye. 5-0.
Thank you, Tina.
Thank you. It's coming back online.
Are we up?
Not yet.
Yes, we are.
Didn't say anything yet, though.
This conference will now be recorded.
All right, out of executive session, no action taken. It's the second applicant.
I will check on that. The time scheduled was 2 o'clock, so,
Oh, if she's available.
okay, I will check.
Does anybody want to, I just start shooting off the questions here. I mean,
Oh, you're good.
well, I just want, if anybody wants to kick right over, go right ahead, I don't care.
No.
I just wanted that 1 or 2, just because that's my number 1 concern always.
Dave and Diane, Jonathan can ask the questions this time.
All right, the other applicant is on her way up.
That's one town I've never heard of, Avon.
I've heard of Avon calling on it.
Open ski
What?
resorts.
I've heard
Avon
of it.
calls that.
Avon? Yeah. All right. I'll move that we recess into executive session in order to discuss employment interviews.
Coach,
For
we gotta wait
item,
until
item
you
number
go.
one,
Huh?
for personal matters
No,
of
wait.
non-elected personnel,
Sorry.
with the applicant and the board for a matter of 30 minutes pursuant to KSA 75-4319. Second by Randy. All those in favor?
Aye.
Camera's on?
Thank you.
This conference will now be recorded.
Okay. Out of executive session, no action taken. This time, who needs to be, just the board and yourself?
David will be in here also.
Okay. I move that we recess into executive session in order to discuss item number one, personal matters of non-elected personnel, employee performance. For how long?
5 minutes.
For 5 minutes with the board, Nikki, and Tina, pursuant to KSA 75-4319B.
Second.
Got a second by Randy. All those in favor?
Aye.
Aye. Diane?
Aye.
5-0.
Okay. Do I shut the door now?
Been a long time in the chair.
Yes.
You got that, Randy.
We've been presented the facts here.
Okay.
Sorry, that was just loud in my office, so I shut the door.
This conference will now be recorded.
Okay. Out of executive session, no action taken. This time, interim appraiser has a recommendation.
Where would you suggest?
We had suggested the 1375.
Where's that fall in at?
It
That
falls
is-
between C and D on
Pay band 4. So the current level is between C and D on the 3. But that's just one. I mean, there's,
would it be terribly offensive to just to stick with C? On pay band 4,
At 13, what, at 1359? 1359.
that's over $1 an hour, yes.
I would make that motion to raise Marcella up to 1359 due to new jobs and new training, new experience to help with the new people, qualifications.
I'll second that.
How many more are you gonna bring us?
I think that's it. I don't know. Nobody
I
else.
mean, conceivably.
Well, everybody else is being trained up right now, so yeah.
That's what I mean,
I
everybody.
mean, yeah, eventually they will.
I mean, you might be in here every week
I hope not.
Yeah, you're gonna have to shut that
until
down.
until we get a pay plan.
So I have to.
Discussion.
I would like to ask then, is this gonna be something that maybe, because we have other department heads that have people who are in critical need also of a pay raise, that have increased their performance or are doing extra at different times, or just haven't had a pay raise in a very long time, and we've known this for a very long time. So is this a policy that we're gonna start, that people should just start doing this? Because I feel like it's unfair to some other people. I feel guilty,
Well,
I really do.
I think we've set a precedent, and department head after department head's gonna come in, and I'm not saying Nikki's wrong, I mean, if I'm
I'm not
department
saying
head,
that either.
I'm probably gonna bring it in.
I'm not saying that either, I'm just saying, because I know there are other people out there that are struggling with a low wage, and if this is what we're gonna do, we need to extend that to the other department heads as well.
Well, I thought that this one was different, because the credentials had went up, and I had heard from our last appraiser that she had achieved a level, and it hadn't been made yet. So this is different than just the department head coming in saying they want this person.
There have been other department heads before you got here. They don't even come anymore because they've asked them multiple times and they haven't gotten it. Because I sat here and I listened to one person, department head, who was asked 2-3 times. Well, 2 department heads actually had asked for this one person to have a pay raise and hasn't gotten it yet. Whatever the reasons are, we still have the same bottom line. People have not been receiving timely pay raises for whether their time in service or their increased in work ability or
So they haven't been
experience or
getting their 6
whatever.
month or your year or none
No,
of
I'm
that.
not dealing with that. I'm talking about employees that have worked for us for a long time.
And then their credentials have raised, so therefore they belong in a higher pay band?
That's what we're doing here now.
We've done that before. That's what we're doing here
That's
now.
what we're doing
That's
here
what I'm
now.
saying.
Okay, so I'm just asking. So that's what we're gonna start doing now with the other department heads.
As long
Am
as
I
their
right?
credentials are putting them into a higher pay band, I would say.
So when you say credentials, are you saying,
If you get some education behind you and
what if
the
you're in a
skill
job
tests you
where
up
you
to
don't
another
have
level?
education, but you've worked here for X amount of years and not had a pay raise? Does that eliminate them then from getting a pay raise? I mean, clarify that for me.
No, you still get your cost of living, you would still get your longevity. You would still get that.
We don't always do that. We
But
haven't
if
always
you
been
don't
doing
test up in some form or fashion, then you don't move on to any other higher bracket. Like, you wouldn't move somebody up from an apprentice to a foreman position without them, so.
Okay,
Becoming
so
some
if you
sort of
work for
test.
if you work for the county for, let's say, 5 years and never had a pay raise, you're saying as long as you didn't go get more education, you're not gonna get a pay raise. Is that what you're saying?
We've had one that he switched from his job to another profession in the appraisal department because he hadn't got that kind of looked at. We hadn't looked at it.
He was a perfectly good example. He would have been one of the people that desperately deserved a pay raise. That doesn't mean he went to schooling and got more education. He deserved a pay raise because he stepped up to the plate. He was an excellent employee and worked very hard. So you're saying that we don't reward those type of performances?
They should be rewarded too. That's just a different perspective. It's a
It's
different,
system not
total
set up
different
for-
office.
Okay, I fully understand, and I'm just trying to put all the people that deserve
There
pay
needs to be
raise.
some sort of credential set, bar set for something like that, and I don't know what that is. But every industry has bars.
I understand that, Jonah, and some of the bars are just simply being a good employee and reporting and paying your employees because they're good, they're dedicated, they work hard, they do good jobs, and so on. And when you have department heads that.
Because you got road and bridge people that.
It's
they
not the
can't-
same. It's not the
But
same.
no, it's not the same, but I mean, a lot of those don't have the ability to go out, okay, now, about the only thing I could go out and do maybe is get me certified as a crane operator, you know?
And then there would be no place for them here.
Right, and then they
Yeah.
didn't, but, you
So-
know, some of those department like that is kind of limited on, you know, how much education I can get
Right.
to these, you know.
It's a total different tier
Yeah.
set.
But,
I understand, but, you know, those have to be looked at too.
Yeah,
Just
yeah.
like, you know,
Well, the best example is what you brought up about the maintenance. That I don't see it here for that.
well, you don't even know who I was talking about, exactly what the situation was. I was just kind of bunching it all in one.
Actually, it's pretty clear. You said they moved to this other department, and that person told them.
No. No, the people that I was talking to have been in the department for years.
Did we vote on anything?
Not yet. No.
Okay.
I missed who seconded that before you
I
started
did.
your discussion. Okay.
I think the biggest thing is what Kent said, is that we're gonna have to get to the pay band, address it. Either we do what you mentioned before, go through and look at some of the lower ones, whether they reevaluate, reset them.
or take what the new pay plan does, but we've got to get there to do that, and see if we can address some of it to get going here, because
Well, otherwise you're burdening Nikki to come up here in 2 more weeks and saying, so this other person now has had to cross-train and move up to this.
And not only that, you take like the maintenance people where they don't have the opportunity to do that. You know, you're just opening up a whole keg of worms. And I don't, you know, personally, I don't care which way you go, but I'm just saying it's unfair to those people. I feel like it's unfair to those people. Because those are restrictions that you're putting on now that they never had the opportunity to do. And I didn't even know we had such restrictions. So I'm sure they don't either. I mean, look at Mike. I mean, you know, he was a good employee. It's not funny, Joe. I mean,
Well, no, it's
very serious.
I'm not laughing at
We
Mike.
just need to not,
Employee.
we just need to
Employee
not bring up
is
any
employee.
specific,
Yeah.
employees'
Names.
information in open
That's
session.
exactly. All right, all those in favor?
Aye.
Aye. All those opposed?
Aye.
All right,
And I still say it's not funny. I think it's a very serious
Well,
situation to treat
it's
people
not
with
funny. You're not
equality.
supposed to bring up employee performance in the middle of open session.
I'd make a motion to adjourn.
I will second that.
I never brought up employee performance.
All those in favor? Aye.
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 Thanks for coming.
Yeah.